So good evening, guys. Yeah. So good evening, all of you. I hope all of you are doing well and you are into your preparation mode. Today, as you all know, we'll be discussing about the antimicrobial drugs. I welcome you all back again to the session of Sparks, which is a revision-based session in a retrograde fashion with all the MCQs. So I hope all of you are well prepared for the topic. And as we all know that in Afmg yesterday, there was a test conducted on antimicrobial drugs. I hope all of you, the regular batch students of Afmg, would have attempted it. And apart from that, the other students, apart from Afmg, would have received all these questions today morning in the Telegram group, that is Afmg for Fmge. If you have not joined the Telegram group yet, guys, I would request you to join the Telegram group as soon as possible to get all the regular updates about all the live sessions and all other videos that would be uploaded. Apart from that, you would also get a variety of MCQs to practice in the group. Okay, and yeah, today we will be starting with the session. Today we'll be discussing all those 30 MCQs that you received in your test or on the Telegram group. And yes, we'll be covering all the antimicrobial drugs in this. But before starting, guys, I would like to reiterate the fact that please remember that this is in no matter a substitution for your actual notes or a substitution for your actual class. Okay, these are meant for your revision purposes, and the classes taken by your core pharmacology faculty is to be followed. Okay, please remember, you need to read, you need to go through your main notes by your faculties, and then just to add up to your knowledge and to revise and recall all those things, and to just remember the important things that what can be asked in the examinations. You can definitely follow these sessions. Okay, so with this, I would like to begin today's session. And yes, King, I feel Dr. Nagar will be soon joining us for the next session. Okay, so let's begin our session today. So the first question will be directly starting with the question, guys, because now we are we will not going to in a delay for sure. So let's begin with our questions, guys. The first question states that all the below given pairs about the drug and mechanism of action are correct except. So as all of us know, mechanism of action have always remained a very important part of the Central Board Institute examination questions. Okay, so please remember, pharma से अगर कोई topic बार-बार पूछा गया है, that is your mechanism of action. So let's see. They have asked us about all are correct except. So we need to find the incorrect match. So before going to the actual question, I would like you to go to this classification. First of all, what are antimicrobial drugs? Antimicrobial drugs are the drugs which act against the microorganisms in any of the infections. Okay, antimicrobial drugs can be divided into different broad categories based on which organism they act on, like antibacterial agents, antiviral agents, antifungal agents, antihelminthic agents, and antiprotozoal agents. So today we'll be starting our discussion with our antibacterial agents. Okay, so antibacterial agents are further subdivided into various categories. But before this classification, depending on the mechanism of action, I would like you all to go through this classification, which is depending on this action on the organism. Like if the drug kills the bacteria, that drug would be known as a cidal drug. And if a drug just inhibits the growth of the bacteria, that drug is known as your static drug. So this is a broad classification. Drugs killing the bacteria are known as cidal drug, whereas drugs just inhibiting the growth of the bacteria would be known as static drugs. Okay, important one. So just a mnemonic to remember all the bactericidal drugs are, the mnemonic is बेवफा. Okay, it had helped me. I hope it would help you too. So please remember, सारी की सारी बेवफा drugs क्या होती है? Cidal होती है. They will kill the bacteria. So where BE goes for what? So BE would go for beta lactam. So please remember, BE goes for beta lactams. VA goes for vancomycin. Okay, F goes for fluoroquinolones, and A goes for aminoglycosides. So please remember which are all the cidal drugs. So please remember the bactericidal drugs are beta lactams, vancomycin, fluoroquinolones, and aminoglycosides. So these are all your bactericidal drugs. I hope you will remember this. Now, this was the classification based on their action on the bacteria. Now, based on the mechanism of action, okay, how do these drugs act? so please remember, based on the mechanism of action, these antibacterial agents can be classified into 3 broad categories. The first one being cell wall synthesis inhibitors. Okay, so please remember, cell wall is a very important aspect of a bacteria. If the cell wall is damaged, so please remember, the bacteria can be easily killed. So first are your cell wall synthesis inhibitors. And which are the drugs which come under cell wall synthesis inhibitors? So the drugs broadly are beta-lactams, vancomycin and bc-tracin. Okay, so the 3 groups which inhibit the cell wall synthesis are beta-lactams, vancomycin and bc-tracin, out of which bc-tracin is used only for local purposes. Okay, so local application or topical application of bc-tracin is generally used. Vancomycin will be discussing in details in our next question, upcoming one. And now I would like you to go through this classification of beta-lactams. So please remember, beta-lactams are the drugs which inhibit cell wall synthesis, that you all know. They are further subdivided into different 4 classes. And what are these 4 different classes? First are penicillins, second are cephalosporins, third are carbapenems, and fourth are monobactams. Okay, and why these drugs are known as beta-lactams? So please remember guys, these drugs contain a ring, okay, and this ring is beta-lactam ring. So all these 4 groups would contain a single ring that is known as a beta-lactam ring. Whereas these 3 groups, that is the first 3 groups, would also contain a second ring. That is penicillins, cephalosporins and carbapenems contain a second ring which is different for all of these classes. And based on this, they are divided as penicillins, cephalosporins and carbapenems. And monobactams, it only contains a single beta-lactam ring. So please remember, monobactam does not contain a second ring, it only contains a single beta-lactam ring, therefore it is known as monobactam. Okay, important one. So I hope you have understood the classification of cell wall synthesis inhibitors. Those are beta-lactams, vancomycin and bc-tracin. Then some of the drugs would inhibit cell membrane synthesis. And which are the drugs which can inhibit cell membrane synthesis? Those are broadly polymyxins. Okay, so polymyxins can be of 2 types, polymyxin B and polymyxin E. Whereas polymyxin E is important to be remembered because it is also known as colistin, and you might have come across a lot of questions where colistin has been asked in questions, right? So cell membrane synthesis inhibitors are polymyxin B and polymyxin E, where polymyxin E is also known as colistin. And one more important drug guys, about which I'll be telling you in the upcoming questions, just remember the name over here, that is daptomycin. Okay, important cell membrane synthesis inhibitor is daptomycin. Okay, so these were about cell wall synthesis and cell membrane synthesis inhibitors. Now talking about the protein synthesis inhibitors. Okay, so please remember, protein synthesis inhibitors. Protein synthesis usually is a function of ribosomes, and as we all know, the bacterial ribosome is made up of 2 subunits. Okay, so the bacterial ribosome is made up of 2 subunits, 50S and 30S subunit, right? So 50S and 30S subunit. So there might be some drugs which will bind to the 50S subunit and then inhibit the protein synthesis, and there might be some other group of drugs which can bind to the 30S subunit of the ribosomes and then can inhibit the protein synthesis. Okay, so now which are the drugs which bind to the 50S subunit and then inhibit the protein synthesis? Those are macrolides, clindamycin, linezolid, chloramphenicol and streptogramins. Okay, so please remember, the drugs binding to 50S subunit of bacterial ribosome are macrolides, clindamycin, linezolid, chloramphenicol and streptogramins. How to remember these? There is a mnemonic MLCs. So please remember, MLCs is the mnemonic where M goes for macrolides, L goes for linezolid, C goes for clindamycin and chloramphenicol, and S goes for streptogramins. Important. Whereas there are some other drugs which bind to the 30S subunit of the bacterial ribosome, and the drugs binding to the 30S subunit of the bacterial ribosome are your tetracyclines and aminoglycosides. So please remember, protein synthesis inhibitors are divided into 50S binding and 30S binding ones. 30S binding ones are tetracyclines and aminoglycosides, whereas 50S binding ones are MLCs. Then talking about your nucleic acid synthesis inhibitors. Now the bacterial DNA or the bacterial RNA can be inhibited, its synthesis can be inhibited, okay, and this is done by these nucleic acid synthesis inhibitor drugs, which are subdivided into folate synthesis inhibitors, DNA gyrase inhibitors and RNA polymerase inhibitors. Okay, so first of all we'll talk about the folate synthesis inhibitors. So the folate synthesis inhibitors, these drugs are also known as anti-metabolites. So just remember the name, folate synthesis inhibitors are also known as anti-metabolites. Important. Now these folate synthesis inhibitor group contains two drugs. First are sulfonamides and second are trimethoprim. Okay, these are sulfonamides and trimethoprim. So please remember, both of them inhibit the folic acid synthesis. Both of them inhibit the folic acid synthesis. Sulfonamide inhibits which enzyme? It inhibits FAST, that is folic acid synthase enzyme. Sulfonamides inhibit which enzyme? Folic acid synthase enzyme. Whereas trimethoprim inhibits which enzyme? So please remember, trimethoprim would inhibit DHFR, that is dihydrofolate reductase enzyme. Important one, question has been asked on this. Okay, so please remember, sulfonamides inhibit folic acid synthase enzyme, whereas trimethoprim inhibits dihydrofolate reductase enzyme, DHFR. Okay, important? Remember this. Then the another group of nucleic acid synthesis inhibitors are DNA gyrase inhibitors. So please remember, DNA gyrase is an enzyme which helps in replication. So just remember, DNA gyrase enzyme helps in replication. So once this DNA gyrase enzyme is inhibited, replication would be inhibited, right? So please remember, the drugs which come under DNA gyrase inhibitors are your quinolones. The drugs are quinolones. Okay, important one. We'll be discussing about quinolones in the upcoming questions. Then, which is the drug which is RNA polymerase inhibitor? So the important drug that you need to remember is rifampin or rifampicin. Okay, rifampin or rifampicin is a RNA polymerase inhibitor. Now, I hope now you have understood the broad classification. So now let's go back to our question, which says all below given pairs about the drug and mechanism of action are correct except. So any of you could answer my question, please? So guys, let's make it an interactive session where you all will be answering. I hope you would have attempted all your questions now. So just type your answers in the chat box. That would make the discussion more interactive, and I want an interactive discussion over here, guys. So please answer in the chat box whatever you feel like. So let's see one by one. Okay, option A says chloramphenicol inhibits protein synthesis. Right, as we know, chloramphenicol inhibits protein synthesis by binding to 50S subunit of your bacterial ribosome. Very good. Then next one is your tetracycline, which inhibits protein synthesis by binding to 50S ribosomal subunit. Is it so? No. Very good, guys. I'm really happy. So please remember, tetracycline inhibits protein synthesis. This statement is correct. But they do not bind to 50S ribosomal subunit. Rather, they bind to the 30S ribosomal subunit. Therefore, option B or the statement B is false. Okay. Very good. Then penicillins, they inhibit cell wall synthesis. Yes, they are a example of beta-lactams. Yes. And option D, metronidazole, it inhibits DNA synthesis. Right. Metronidazole interferes in the DNA synthesis and it inhibits the DNA synthesis. Okay. So the answer over here to the first question is option B, tetracyclines. Moving further, guys, to our next question, which states isoniazid induced peripheral neuritis is common in which patients? Option A, slow acetylators. Option B, fast acetylators. Option C, fast oxidizers. And option D, slow oxidizers. So just answer in the chat box, guys. Keep on answering. As soon as you see a question, keep on answering. I would be very happy to see that. So please tell me the answer. Till that, I will tell you important points about isoniazid. As you all know, what is isoniazid? Isoniazid belongs to which group of drugs? Yes, it belongs to the anti-tubercular drugs. So please remember, isoniazid is a first line anti-tubercular agent. All of us know that, right? So now, the second thing. Yes, very good. So please remember, isoniazid is metabolized by which mechanism? As we all know, isoniazid is metabolized by acetylation. Isoniazid is metabolized by acetylation. Therefore, by knowing just the mechanism of metabolism of isoniazid, we can just rule out option C and option D. Okay, it is not metabolized by oxidization. Therefore, both of them are ruled out. Right. So, isoniazid is metabolized by acetylation, either slow or fast. That we'll see now. Okay. So, as it is metabolized by acetylation, I'll just explain you the metabolism of isoniazid. What happens? Isoniazid, when it is metabolized, it is acted upon by the enzyme N-acetyl transferase. It is acted upon by the enzyme N-acetyl transferase and it is converted to acetyl isoniazid. It is converted to acetyl isoniazid. And this acetyl isoniazid then is further converted to its last metabolite product, that is known as acetyl hydrazine. That is known as acetyl hydrazine. So please remember, isoniazid is converted to acetyl isoniazid and finally to acetyl hydrazine. So now let's see what happens in slow acetylators and what happens in fast acetylators. So in slow acetylators what happens, the metabolism would be impaired. ठीक है, acetylation बहुत धीरे धीरे हो रहा है. So what happens is this process would be slowed down somewhere, and therefore the isoniazid drug would keep on accumulating in the body. And as we all know, as isoniazid will keep on accumulating in the body, what happens there, it can cause deficiency of, so please remember, it can lead to deficiency of what? Just a minute. It can lead to deficiency of your vitamin B6, also known as pyridoxine. It can lead to deficiency of vitamin B6 or pyridoxine, finally leading to peripheral neuritis, or peripheral neuropathy. Okay, this is the mechanism of action of isoniazid in cases of peripheral neuritis. Then what happens in fast acetylators? Fast acetylators में क्या होगा? Isoniazid is metabolized faster or rapidly. So isoniazid is rapidly converted to this product, which is acetyl hydrazine, and as it cannot be rapidly excreted out of the body, therefore it keeps on accumulating inside the body, and therefore levels of acetyl hydrazine would increase. And acetyl hydrazine is a metabolite product which is hepatotoxic, So please remember, in fast acetylators, which is the side effect which is seen, it would be hepatotoxicity, and in slow acetylators, which is the side effect seen, it is peripheral neuritis. So ना ज़्यादा अच्छा है ना कम अच्छा है, it should be in a proportion. So please remember, slow acetylators, peripheral neuritis; fast acetylators, hepatotoxicity. I hope you have understood this. Now the answer over here, as we all know, it is option A, slow acetylators. Okay, so isoniazid induced peripheral neuritis is common in slow acetylators. Now just I would like you to remember that acetylation is the mechanism of metabolism for which drugs? It is the mechanism of metabolism for ship drugs. Okay, and this ship drugs are very, very important. These questions have been asked repeatedly in the examination, and I would like you to remember these ship drugs. Don't forget it. नींद से भी उठा के कोई पूछे, so बिल्कुल नहीं भूलना है. Okay, so please remember, S goes for sulfonamides. That is folic acid synthesis inhibitors. So please remember guys, how to remember the mechanism of action. जहाँ भी कोई group का या किसी drug का नाम सुनो, just keep on recalling the mechanism of action of that drug. Okay, बार बार recall करने से ना things would get easier. Okay, suddenly अपने आप मुंह पे नाम आने लगेगा. So please remember, sulfonamides are folic acid synthesis inhibitors. Then H goes for hydralazine, which is an antihypertensive drug. Then I goes for isoniazid, and lastly P goes for procainamide. Very good Sonali. And P goes for procainamide, which is an anti-arrhythmic drug. Okay, so please remember, sulfonamides, hydralazine, isoniazid and procainamide. All of these drugs are metabolized by acetylation. And what is the characteristic side effect which can be seen with these sheep drugs? That is very much important. The characteristic side effect which is seen with sheep drug is, anybody? The characteristic side effect which can be seen with these sheep drugs is, so please remember, it is systemic lupus erythematosus. SLE is the characteristic side effect. So please remember, sheep drugs are metabolized by acetylation, and second point, they can cause SLE. Okay, these two are the most important points I would like you guys to remember at any cost. Okay, very good. Now moving further guys to our next question, and that states, a neonate was brought, okay, important, a neonate was brought to the OPD with non-bilious vomiting at 3 weeks of life. On palpation, a olive-shaped lump was felt per abdomen. Which among the following drug used by mother can predispose to this condition? Now we need to come to a diagnosis first. So I hope guys, I am like all of you are still there and the session is going fine now. Just really sorry, I apologize for the interruption in the connection. Just let me check once. Hello. I'm not. हाँ हाँ हेलो बोलो. अभी स्टार्ट करा मैंने, एक सेकंड जस्ट a minute. So I hope guys now the session is going fine. There might be some delay in the session. So I hope now the session is going fine. There might be some delay. Just apologize for the technical error that happened. And now let's begin the session. Okay. If you can hear me clearly, if I'm audible very clear, if you can see the screen, just put a thumbs up in the chat box, guys, so I can just proceed. Because it would be difficult if you miss on some point here or there. So just put a thumbs up in the chat box or just reply, so I can just proceed with the session, guys, now. Okay. So yeah. Any one of you just revert back so I can just start with the session, guys. I hope I am audible to you guys clearly, and I am beginning the session again. Okay. So just answer about this question. The question states, a neonate was brought to the OPD with non-bilious vomiting at 3 weeks of life. On palpation, a olive-shaped lump is felt per abdomen. Which among the following drug used by mother can predispose to this condition? So now just tell me which is the most probable drug that you think is predisposing to this condition. But prior to that, guys, I would like you all to come to a provisional diagnosis. And what is a provisional diagnosis that we can come to by this history which is given? Thank you, guys. Thank you. Okay. So the provisional diagnosis in this case, a neonate at 3 weeks of life. Okay. A neonate at 3 weeks of life. This is a characteristic age at which this disease would present to us. Okay. A neonate at 3 weeks of life with non-bilious vomiting, that is non-bile stained or non-bile containing vomiting. So the obstruction, there is some obstruction that is leading to vomiting, and that obstruction is might be somewhere at the level of the stomach. Therefore the bile is not mixed with the vomiting, right? So there is some obstruction at the level of the stomach that you can understand with this. So non-bilious vomiting at 3 weeks of life. On palpation, olive-shaped lump was felt per abdomen, and this olive-shaped lump is characteristically seen in which surgical condition? Yes, very good, guys. It is characteristically seen in cases of CHPS, that is congenital hypertrophic pyloric stenosis. Okay, when the pyloric musculature is hypertrophied, and that causes narrowing of the pyloric canal, that is your CHPS, congenital hypertrophic pyloric stenosis. So these people are talking about congenital hypertrophic pyloric stenosis, and which of the following drugs can cause CHPS? Okay, so this is the actual question. So yaad rakhna, just make it simpler every time. Just come to a diagnosis first and then try to answer the actual question. So now anybody can answer the question, guys. So just answer. Any answers? So the answer to this question, option A, streptomycin, option B, thalidomide, option C, erythromycin, and option D, lithium. So please remember guys, the answer to this question would be option C, erythromycin. Okay. So now let's discuss about the group of erythromycin, and which group erythromycin belongs to. As we all know, erythromycin belongs to which group of antibacterial agents? It belongs to your macrolides. It belongs to macrolide group of drugs. Okay, important one. And now let's discuss just few important points that you would remember about your macrolide group of drugs. Okay, कुछ important points हर group के बारे में याद रखने हैं. So I'm giving you some points that you need to remember about macrolides. First point, macrolide is mostly effective against gram-positive organisms. So please remember, macrolides are mainly acting against what? Gram-positive organisms. First point. Second point is that the characteristic side effects of macrolides that you need to see. The side effects that are seen with macrolides, the important ones, first of all is diarrhea. Okay, so please remember, macrolides stimulate the motilin receptors in your GIT, which increases your GI motility, leading to diarrhea. Therefore, macrolides can also be used in treatment of post-operative gastroparesis or paralytic ileus. Okay, this is the reason, because it induces diarrhea. First thing. Second, it can lead to allergy. So please remember, most of the antibiotics can cause allergy. Macrolides is just one of them. And the important side effect that you cannot forget at any cost is your reversible ototoxicity. Okay, the reversible ototoxicity is the most important side effect of macrolides. Okay, important one, just remember this. So the most important side effect of macrolides is reversible ototoxicity. That is, they are toxic to your ears. And reversible means as soon as you stop the macrolides, the ototoxicity would be reversed. Okay, the patient would be totally normal, absolutely fine. Now, the important drug from this group is your erythromycin. And why erythromycin is important? First thing, okay, there are two important things to be remembered about erythromycin. First, it is contraindicated in cases of pregnancy. It is contraindicated in cases of pregnancy. And why is it contraindicated in cases of pregnancy? One reason we have already seen. One reason is your CHPS. It leads to congenital hypertrophic pyloric stenosis. And second, it can lead to cholestasis. Second, it can lead to cholestasis. That is stasis of bile. Okay, it can predispose to jaundice. So the two side effects that erythromycin can lead to if given in pregnancy are, first is CHPS and second is cholestasis in the neonate. Important two side effects. Okay. Apart from this, now the another drug that you need to remember from this group that is very commonly used in routine practice is your azithromycin, azithromycin, which is the very long acting macrolide. Important point, azithromycin is a very long acting macrolide. And second point, it was also used in cases of treatment of mild to moderate COVID pneumonia. Okay, so please remember, it was used in cases of treatment of mild pneumonia. Okay, it was one of the agents that was used. Okay, so important one. Now, last thing about macrolides, guys, that you need to remember, that macrolides is used as a drug of choice in which conditions. Okay, hamesha yaad rakhna, drug of choice will always remain a hot shot favorite topic for all examiners. So remember, macrolides are drug of choice for CLAP. Okay, so the CLAP is the mnemonic. So please remember, macrolides are drug of choice for CLAP, where C goes for chancroid. Okay, so please remember, you might have studied this in dermatology. Chancroid is a genital ulcer. It is a STD which is caused by Haemophilus ducreyi, which is treated by macrolides. Then L for your Legionella. Okay, L goes for your Legionella. And Legionella, as we have discussed in recipe, it is a common cause for your atypical pneumonia. A goes for atypical pneumonia. A goes for atypical pneumonia. And lastly, P goes for your pertussis. Pertussis, also known as whooping cough or 100-day cough. Important. So remember this, that macrolides are drug of choice for which four conditions? CLAP is the mnemonic, C for chancroid, L for Legionella, A for atypical pneumonia, and P for pertussis or whooping cough. These are the most important points, guys, that you need to remember about macrolides. I hope I am clear, and then we can move on to the next question. Just before that, I would like you to explain and just give you an idea about some other drugs. Streptomycin belongs to which group of drugs? streptomycin belongs to aminoglycoside group of drugs, and the characteristic side effect of streptomycin would be ototoxicity as well as nephrotoxicity. Okay, aminoglycosides can predispose to both auto as well as nephrotoxicity. Then important drug side effects in charo ke पूछे जाते usually. Okay, these are commonly repeated side effects for these drugs. And next one is thalidomide. Thalidomide is a drug which is used in cases of type 2 lepra reaction, also known as erythema nodosum leprosum. Okay, so thalidomide is a drug used in cases of type 2 lepra reaction, which is also known as erythema nodosum leprosum. And this thalidomide can cause a teratogenic effect if given during pregnancy, and the teratogenic effect is known as what? The condition is known as phocomeria. And this was the question which came in this FMG 2021 session. Thalidomide can lead to phocomeria, where there are only seal-like flippers. That is, the limbs of the baby would not be developed properly. They would be just limb birds would be there, which would appear like a seal flippers. Okay, and this condition is known as phocomeria, important one. And lastly, why I put lithium in this? Lithium, though it is not an antibacterial drug, I would have confused with some antibacterial drug, right? But lithium ka side effect hamesha pucha jata hai, and I wanted it to discuss over here. So please remember, lithium also the question came in FMG 2021 session. Lithium characteristic side effect is Epstein's anomaly. Lithium is a mood stabilizer that you would usually study in psychiatry. But the characteristic side effect of lithium is Epstein's anomaly, and this question from pharma is consecutively repeated in every alternate sessions. Okay, so important ones. Don't forget about phocomeria seen with thalidomide and Epstein's anomaly seen with lithium. Moving further to our next question, guys, which states a businessman had to visit a malaria endemic zone in West Bengal for a business forum of 5 weeks. Which among the following drug is indicated as a prophylactic measure before visiting a malaria endemic zone? So please tell me what is the answer. Options are A. mefloquine, B. doxycycline, C. artesunate, and D. primaquine. What is your answer, guys? So just tell me the answer for this question. I hope you would have answered it right. So I'm just telling you that option C and option D, both of these can be ruled out easily, because these of the two drugs are the antimalarial agents which are used for treatment and not for prophylaxis. So please remember, artesunate and primaquine are the two drugs which are usually used in cases of used for treatment of malaria and not for prophylaxis of malaria. So now we are left with only two options, option A and option B, that is mefloquine and doxycycline, which are used as prophylactic measure, Okay, so yes, very good, Mukesh. Yeah, the drugs which are safe in pregnancy, mostly we avoid all drugs in pregnancy. Okay, all the antibacterial agents, all the antimicrobials are considered teratogenic in pregnancy somewhat, but we tend to avoid it. But if in case we need to give some drugs, those are your PCM. Yes, PCM is the mnemonic, that is penicillins, cephalosporins, and macrolides. Okay, these are safe in pregnancy. So now any answers for this question? Very good, very good. The answer over here is option B, doxycycline. So now what is the criteria? How we choose meflon, how we choose doxy? So just please remember, now talking about the prophylaxis of malaria. Okay, talking about the prophylaxis of malaria, we use two drugs. First is your doxycycline and second is your mefloquine. So now what is the criteria based on which we decide either doxy or meflo? So please remember, if the exposure is going to be less than 6 weeks, okay, if the exposure is going to be less than 6 weeks, doxy should be the choice. And if the exposure is going to be more than 6 weeks, then meflo should be the choice. So please remember, if the businessman was going to a malaria endemic zone for less than 6 weeks, then doxy would be preferred. And if it is going for a long trip, that is for more than 6 weeks, then mefloquine would be preferred. So please remember, for short-term prophylaxis, usually we prefer doxycycline. And for long-term prophylaxis, usually we prefer mefloquine. Now I hope that you have understood this. Just remember, how is the prophylactic regime? 2 tablets of doxycycline are given before the journey. Okay, so 2 tablets of doxycycline are given before the journey, whereas mefloquine is a long-acting tablet. So please remember, mefloquine is a long-acting drug, a long-acting antimalarial agent, which is given weekly. Okay, it is given once a week. And mefloquine would be given 2 weeks prior. Okay, it would be given 2 weeks prior, and 4 weeks after the journey. Okay, so mefloquine is given 2 weeks prior the journey and 4 weeks after the journey. Okay, this is how you need to understand the prophylactic regime of malaria. Okay, short term doxycycline, long term mefloquine, less than 6, more than 6. Okay, I hope now it is clear to you. And what is the drug of choice for treatment of malaria? So please remember, the drug of choice for treatment of malaria, I'm asking, it should be what? It is your ACT, that is artemisinin based combination therapy. Okay, so please remember, the treatment for the treatment of choice for malaria would be artemisinin based combination therapy, where artemisinin would be there along with a long acting antimalarial agent. Okay, artemisinin plus a long acting antimalarial agent. Now let's discuss about ACT in the next question now. Okay, so the next question says, a patient from Manipur was diagnosed as a case of uncomplicated falciparum malaria. Okay, important one is this. Which of the artemisinin based combination therapy is recommended by NVB-DCP? What is NVB-DCP? You will study in PSM, that is National Vector-Borne Disease Control Program. So according to NVB-DCP, what is the ACT preferred? Okay, artemisinin based combination therapy used in this case. And there are different options. Anybody? What would be the answer? So just before you tell the answer, I would like to discuss about the last drug that we left over there. And there are 2 or 3 important points about the last drug that we left in the last question, and that is your primaquine. Why I wanted to go to primaquine back? There is a reason for that, okay? Because primaquine is an important drug, but we tend to forget about it every time. So please remember, primaquine is a drug which is not used in treatment or prevention of malaria, okay? Because it does not act on the erythrocytic stage of falciparum. It does not act on erythrocytic stage of falciparum. As we all know, Plasmodium species reside in the RBCs of an individual. That is your erythrocytic stage. But primaquine does not act on the erythrocytic stage of your Plasmodium species. Therefore, it cannot be used for treatment or prophylaxis. So what is it used for? So please remember, it is used to prevent relapses. So to prevent a relapse of malaria, primaquine is generally used. And which are the Plasmodium species where relapses are common? So as we all know, relapses are common with which Plasmodium species? Plasmodium vivax and Plasmodium ovale. Yes. Okay, in both these species, vivax and ovale, relapses are very much common. So to prevent these relapses in Plasmodium vivax or ovale malaria, we can use primaquine along with the ACT. Okay, and primaquine is contraindicated in cases of pregnancy and in infants. It is contraindicated in cases of pregnancy or infants. Okay, so this was about the last drug that we left. Now coming back to our question. Yes, very good guys, very good. Why are you getting confused? I have already told a patient is from where? A patient is from Manipur. Okay, so please remember, I am not a racist, but it is the need of the question that I need to just mention the race of the individual. And always remember, I have always told you, the age, the sex, the race, or the where the patient belongs to has always played a very important role for coming to a diagnosis. Okay, yes, most of you are right. That is option D, artemether plus lumefantrine. This is the treatment regime which is preferred in cases of northeastern states of malaria. So please remember, okay, there are 2 types of ACTs which can be used in India. Okay, artemisinin based combination therapy are different for our northeastern states, that is our 7 sisters, and they are different for other parts of the country. Okay, they are different for our other parts of the country. So which is the preferred ACT used in northeastern states? We have already discussed. It is your artemether along with lumefantrine. And how to remember this? Both have me in them. Okay, so please remember, I'm not sure it would help you or not, but just remember, it can just ease up your recall. Okay, so please remember, artemether plus lumefantrine is the best ACT that can be used in cases of northeastern states. Whereas in other parts of the country, the preferred one is your artesunate. Okay, artesunate plus sulfadoxine pyrimethamine combination. So please remember, in other parts of the country, the preferred ACT for malaria would be artesunate plus sulfadoxine pyrimethamine combination. Okay, I hope so that you have understood this. Now in the question they have also told about uncomplicated falciparum malaria. Okay, why is there a need to mention it as uncomplicated? Because yes, remember, falciparum malaria commonly complicates. Okay, it can complicate. Okay, so as we all know, Plasmodium falciparum is the most common type of Plasmodium species for causing malaria in India. The most common one is falciparum. It can complicate. Okay, it can disseminate, or it can just disseminate into your CNS, causing what? Causing your cerebral malaria. Okay, causing your cerebral malaria. And I'm just trying to integrate path over here. In cerebral malaria, please remember, in cerebral malaria, usually the granuloma seen is known as Dirk's granuloma. This question was previously asked, and therefore I felt a need to tell you this, that in cases of cerebral malaria, Dirk's granuloma would be seen. This is just a question from patho. Then, now going further, yes, A and D. A in other parts of the country and D in northeastern states of India. Now I hope you have understood malaria as a whole. Okay. Now moving further, guys, with our next question, and that states all the below given statements about aminoglycosides are true, except, that is, we need to find the incorrect or the false statement, right? ये तो समझ में आ गया. So ये कभी नहीं भूलना है. Okay, except. ये हमेशा याद रखना है what is asked. Okay, so please remember we need to find the incorrect statement. So just before going to each statement, we'll just recall aminoglycosides. Aminoglycosides as a group, what are the points to be remembered? I have already told you, I'll tell you points about each and every group. So now we have finished with microlides, we'll just recall some points about your aminoglycosides. First of all, the first point being aminoglycosides cannot be orally absorbed, and therefore they are preferred in which form? They are preferred in injectable form. So most of the aminoglycosides are injectable, rather all of them. Okay, they are not absorbed orally, therefore they are given as injectables. They are injectables. One point. Second, they have no action on anaerobic bacteria. They have no action on anaerobic organisms. Important one. Okay. We tend to forget, yes, aminoglycosides act on a variety of organisms, but they have no action on anaerobic organisms. And the third point, important one, were they a part of Bewafa? Yes, they were, right? Therefore, they are bactericidal drugs. So please remember, these are bactericidal drugs which will kill the bacteria. Okay, so three important points about aminoglycosides. First, they are injectables because not absorbed orally. Second, no action on anaerobic organisms. And third, they are bactericidal drugs. Okay, now we'll remember some of the important side effects of aminoglycosides. I have already told you one aminoglycoside prior, that was streptomycin. And what did I mention over there? That aminoglycosides have a very characteristic side effect to be remembered, and those two are, first is nephrotoxicity and second was ototoxicity. So please remember, the nephro and ototoxicity seen along with aminoglycoside is irreversible. It is irreversible. Okay, please remember this. Okay, nephrotoxicity and ototoxicity are the two most important side effects of aminoglycosides. Now, which is the aminoglycoside with maximum nephrotoxic action? Which is the aminoglycoside which has maximum nephrotoxicity? So N for nephrotoxicity, N for neomycin. So please remember, neomycin is the drug which can cause maximum nephrotoxicity. Neomycin causes maximum nephrotoxicity. And just remember all the drugs, important drugs from this group. Which are they? First is streptomycin, which is a first line anti-tubercular agent. And the others are gentamicin, a broad spectrum antibiotic, and the others being tobramycin, used as topical, neomycin, maximum nephrotoxicity, and the others are kanamycin, amikacin and capreomycin. And all growth of the bacteria, they are not killing the bacteria because they were not part of your Bewafa group. Okay, so tetracyclines are bacteriostatic drug. Second, we'll just remember some important side effect about tetracyclines. First is renal failure. Yes, tetracycline can predispose the individual to renal failure. Exception being doxycycline. So please remember, doxycycline is the only tetracycline which is safe in cases of renal failure. This is the important point. Why? That I will explain you in the next question. Okay, so please remember, renal failure में tetracyclines are usually contraindicated. Exception is doxycycline. Next, the next side effect seen with tetracyclines is phototoxicity. The next side effect seen is phototoxicity. Okay, and important one, maximum phototoxicity is seen with which drug? Maximum phototoxicity is seen with dimeclocycline. Maximum phototoxicity is seen with dimeclocycline. Important one. Next, it can also lead to diabetes insipidus. And what is diabetes insipidus? It is due to decreased levels of your antidiuretic hormone. Okay, it is due to decreased levels of ADH. Okay, and which tetracycline group of drugs can lead to diabetes insipidus. And which is the drug which has highest risk of causing diabetes insipidus? The highest risk among tetracyclines to cause diabetes insipidus is seen with demeclocycline again. Okay, so please remember two most important points about demeclocycline. It is the drug causing maximum phototoxicity and it is the drug causing highest risk of diabetes insipidus. Two most important points that you need to remember. Whereas tetracyclines are also contraindicated in cases of liver failure. They can rather predispose to worsening of the condition. They are contraindicated in cases of liver failure. And last one, they are also autotoxic. They lead to vestibular dysfunction. These drugs, tetracyclines, can lead to vestibular dysfunction, important one, okay. So they are also autotoxic drugs. But what is the important point to be remembered? They cause vestibular dysfunction. But which is the drug which causes maximum vestibular dysfunction among them? That is minocycline. So please remember, maximum vestibular dysfunction is seen with minocycline. Maximum phototoxicity is seen with demeclocycline. And maximum risk of diabetes insipidus is again seen with demeclocycline. Three most important points about tetra. Okay. Now, tetracyclines are also contraindicated in cases of pregnancy. Okay, please remember, tetracyclines are also contraindicated in cases of pregnancy or in children. Why? Because they lead to some dentition or bone problems. There can be some deformity seen either in dentition or in skeletal maturation. So therefore, they are contraindicated in cases of pregnancy and in children. This is the important aspect about tetracyclines that you need to remember. And the last point that we will talk about is again the drug of choice. Apply करना is important ना. Tetracycline पूरा पता है, but वो कहाँ use करते यही नहीं पता. So that cannot be the case. Therefore, tetracyclines can be used as a drug of choice in which conditions? Please remember, four most important conditions I am telling you. First are all the rickettsial infections. Okay, so tetracycline are the drug of choice in all the rickettsial infection. That is epidemic typhus, endemic typhus, scrub typhus, Indian tick typhus, Rocky Mountain spotted fever. Okay, or your query fever. All of these rickettsial infections, the drug of choice would be tetracyclines. This is a very important question that can come from your PSM or from your microbiome, also from pharma as well. Okay, so drug of choice for rickettsial infections is tetracycline. Second, they are also drug of choice in cases of granuloma inguinale. This again you might have studied in your dermatology. Granuloma inguinale is a genital ulcer. It is a STD. Okay. And it is also known as donovenosis. For that also the drug of choice are tetracyclines. Third condition is your LGV, that is lymphogranuloma venerum. Again, it is a genital ulcer. Okay, it is a sexually transmitted infection. In that there would be enlarged lymphadenopathy along with genital ulcer. And in this condition also the drug of choice are tetracyclines. And lastly, the last option is your cholera. And the last disease where tetracyclines are a drug of choice is cholera, rice watery diarrhea. Okay, so the four diseases where tetracyclines are drug of choice are A, rickettsial infection. Second, granuloma inguinale, also known as donovenosis. C, lymphogranuloma venerum. And D, cholera. Okay, important four diseases that you need to remember. Now, come back to our question that states, a patient with polyuria and nocturia presented to you. You suspect nephrogenic diabetes insipidus, and which of the following drugs can cause this condition? As we all know, highest risk among all the tetracyclines to cause diabetes insipidus is seen with option B, demeclocycline. Okay, so the answer to this question is option B, demeclocycline. Guys, keep on answering in the chat box. Okay, keep on answering in the chat box. That would be very easy for you. Okay, be interactive. भाड़ में जाने दो. Whoever is judging you, that does not matter at any cost. Okay, just believe in yourself, and whatever you feel like, just answer in the chat box. If you're wrong, then you would not repeat that mistake again in future. Okay, that's very much important. So bring up that courage and answer in the chat box. The next question, guys, that we'll discuss: which of the following drug does not require dose reduction in renal failure? Okay, which of the following drug does not require dose reduction in cases of renal failure? So what they are asking, they are trying to ask which of the following drugs is actually safe in renal failure, right? यही मतलब है उनका. Does not require dose reduction in renal failure का मतलब ये है कि which of the following drug is safe in renal failure. Okay, we have simplified the question. Now let's talk about some nephrotoxic drugs. Okay, so let's talk about some nephrotoxic drugs. So nephrotoxicity have been a very important part. Questions have been asked on this again and again and again from pharma. Which of the drugs are not nephrotoxic, or which of the following is nephrotoxic? Okay, so the mnemonic that I have for all your antibacterial agents which are nephrotoxic is fat PSV. Okay, the mnemonic that I have is fat PSV. And what is the mnemonic? F goes for fluoroquinolones. F is for fluoroquinolones. A is for aminoglycosides and amphotericin B. T is for tetracyclines. T is for tetracyclines. P goes for penicillins, and penicillins का भाई कौन? Cephalosporins. So both of these are nephrotoxic drugs. S goes for your sulfonamides. S goes for sulfonamides. And lastly, V goes for again vancomycin. Okay, so important ones. Nephrotoxic drugs are fat PSV, F for fluoroquinolones, A for aminoglycosides and amphotericin B, T for tetracyclines, P for penicillins and cephalosporins, S for sulfonamides, and V for vancomycin. All of these are antibacterial except amphotericin B, which is a antifungal agent. Okay, we'll be talking about amphotericin B because it is very important nowadays. Okay, so all of these drugs are nephrotoxic. What is the answer, guys? Please keep on commenting in the chat box. I hope to see you answer in the chat box very actively. So keep on commenting in the chat box, guys. Till that time, now let's come to the group of these drugs. Let's understand the group of these drugs. Gentamicin belongs to which group? Gentamicin belongs to aminoglycosides. Vancomycin is a drug, okay, that is cell wall synthesis inhibitor that we have seen. Amphotericin B is an antifungal drug, and doxycycline is a tetracycline group of drug. Okay, important one. Now let's see which are nephrotoxic groups. Aminoglycosides we have already discussed. Aminoglycosides are nephrotoxic and autotoxic. Important one. Second, vancomycin. Vancomycin is a nephrotoxic drug that we have seen. Then amphotericin B, yes, amphotericin B is also a nephrotoxic antifungal agent. Lastly, doxycycline belongs to tetracycline group. Tetracycline group as a whole is a nephrotoxic group, but they have specifically mentioned about doxycycline. And what did we mention in the last question? If you were attentive, you would have seen I said usually tetracyclines are contraindicated in cases of renal failure except for doxycycline. Doxycycline can be safely given. And what is the reason behind that? So please remember, this question has been previously asked. The reason behind giving doxycycline safely in cases of renal failure is it is excreted via bile. So please remember, excretion of doxycycline is via bile. Therefore, it is completely safe in cases of renal failure. Okay, so only tetracycline given in cases of renal failure safely is doxycycline because it is excreted via bile. Okay, so the answer over here is option D, doxycycline. Moving further, guys, now to our next question. Very good, guys. Now the next question states, what is the drug of choice for scrub typhus during pregnancy and otherwise? Okay, so please remember, we need to find the drug of choice for scrub typhus. As we all know from microbio, scrub typhus is which infection? Scrub typhus is a rickettsial infection. Okay, scrub typhus is a rickettsial infection. Keep on answering for this question also, guys. Keep on answering for this question. So scrub typhus is a rickettsial infection. Okay, scrub typhus is a rickettsial infection. And they have asked, firstly, so the first is pregnancy and second is otherwise. So the drug of choice for rickettsial infections or scrub typhus in pregnancy क्या है and बाकी conditions में क्या है. So as we all know, normally the drug of choice for all rickettsial infections we have discussed is what? Tetracycline. Specifically which drug? Doxycycline, because it is a safe drug to be given among tetra. So please remember, doxycycline is the drug of choice in all rickettsial infections. But पहले क्या पूछा उन्होंने? पहले they have asked pregnancy and then they have asked otherwise. Okay, so the first option over here should be pregnancy. And as we all know, doxycycline or any of the tetracycline group of drugs is what? It is teratogenic. These are what? Teratogenic. They are usually contraindicated in cases of pregnancy. Okay, these are contraindicated in cases of pregnancy. And why? What is the reason? Because they cause some bone and dentition issues, right? So now, what can be an alternative to doxycycline in pregnancy? So please remember, a safer drug which acts by the same mechanism but can be safely given in pregnancy is macrolides. We discussed the mnemonic PCM, right, earlier only. PCM, where M was for macrolides. PCM are safe in pregnancy. P for penicillin, C for cephalosporins, and M for macrolides. So please remember, macrolides are safer choice. And which is the macrolide which is the safest? As we all know, routinely कौन सी use करते हैं? Azithromycin is the safest macrolide that we have. So please remember, guys. So the answer over here to this question would be option D, azithromycin and doxycycline. So the drug of choice for rickettsial infections in pregnancy would be azithromycin. Otherwise would be doxycycline. I hope now this is very much clear to you guys. Okay, very good, guys, very good. You have been answering right and I'm very happy to see that. Now just remember few points about chloramphenicol. We'll be not discussing it in details, very much details, just important points about chloramphenicol. Chloramphenicol कहाँ देखा था तुमने? First of all, it is a protein synthesis inhibitor. Yes, it is a protein synthesis inhibitor. Bind to which subunit? 50S ribosomal subunit of bacteria. And the important point that you need to remember is about the side effect of chloramphenicol. Two important side effects of chloramphenicol are, first is bone marrow suppression. First, it causes bone marrow suppression leading to erythropenia, that is anemia, leukopenia, all these conditions can be seen. And second side effect, a very characteristic one जो पूछा जाता है बार बार और शायद याद भी रह जाता है easily, that is your grey baby syndrome. What is that? Grey baby syndrome. And why it is known as grey baby? Because chloramphenicol can lead to diffuse cyanosis. Okay, therefore it is known as grey baby syndrome. Chloramphenicol causes bone marrow suppression and grey baby syndrome. Chloramphenicol is a of meningitis or anaerobic infections. Okay, just remember these things. I hope now this is clear to you, and now we can proceed with the next question. And that question states, guys, a patient presents with fever, abdominal pain, watery diarrhea. Lab investigation showed WBC count of 15,000 per microliter. The patient gives history of being treated with clindamycin for cellulitis. What is the drug of choice for this patient? So now let's see what is the condition first. Patient presented with fever, abdominal pain and watery diarrhea. Okay, there is leukocytosis on lab investigations. So mostly we are suspecting some diarrhea-like condition. Okay, so we are suspecting some infection in your gastrointestinal tract and an infection with gastrointestinal tract, and they have specifically mentioned about clindamycin. तो ऐसा तो होगा नहीं कि clindamycin फालतू में दिया है question में. So there might be some role of clindamycin for this in this, right? So it is something which is clindamycin-induced diarrhea. Okay, and a clindamycin-induced diarrhea usually is seen where? Yes, please remember, it is usually seen in cases of pseudomembranous colitis. So a provisional diagnosis in this condition is what? It is pseudomembranous colitis. Okay, clindamycin was usually used for some anaerobic infection which was causing cellulitis in that individual, but that has led to some side effects like diarrhea vagera. Okay, and that we are suspecting it is pseudomembranous colitis. Few important points that you need to remember about pseudomembranous colitis are, first, pseudomembranous colitis hota kyun hai? There is inflammation of your colon. Why? Because the normal commensals of your gut or normal bacteria of your gut, they are suppressed. Okay, and these normal commensals of your gut are suppressed due to a prolonged uses or a irrational use of some broad spectrum antibiotics. ओके कुछ ब्रॉड स्पेक्ट्रम एंटीबायोटिक्स तुम बिना सोचे समझे यूज करे जा रहे हो, जिसकी वजह से क्या हुआ है? दैट हैड लीड टू सप्रेशन ऑफ योर नॉर्मल कमेंसल्स और नॉर्मल बैक्टीरिया इन द गट, and which has led another organism to take over, a super bug to take over and cause an infection. And which is that super bug? So please remember, the most common organism which is responsible for causing PMC is, please remember, it is Clostridium difficile. So please remember, the most common pathogenic organism causing pseudomembranous colitis is Clostridium difficile. Which toxin of Clostridium difficile? This question can be asked from micro, that is lecithinase toxin. So please remember, lecithinase toxin of Clostridium difficile can lead to pseudomembranous colitis. Now, we have already seen, okay, I have told you that some broad spectrum antibiotics are used and that can lead to PMC. Which are those broad spectrum antibiotics? So please remember, the most common cause, okay, or the most common drugs which can predispose to pseudomembranous colitis are, first would be third generation cephalosporins. Okay, first are third generation cephalosporins like ceftriaxone followed by clindamycin. Both of these are broad spectrum antibiotics. Okay, these can suppress the normal commensal or flora of the gut, and that can lead to infection by Clostridium difficile, and Clostridium difficile can lead to pseudomembranous colitis. So please remember, the most common cause of pseudomembranous colitis is third generation cephalosporins followed by clindamycin. Okay, so this is the most common cause. Now, what is the drug of choice for pseudomembranous colitis? So please remember, the drug of choice for pseudomembranous colitis is oral vancomycin. The drug of choice for pseudomembranous colitis is oral vancomycin. So please remember, vancomycin is usually an injectable drug. It is usually given by injectable route. Okay, IM दी जाती है. It is given IM most of the times, intramuscular. But the only oral indication of vancomycin is pseudomembranous colitis because it has to act in the gut now. Therefore, the only oral indication of vanco is pseudomembranous colitis. Important point to be remembered. This question was asked prior. Okay, next one. अगर vancomycin is given IV, okay, if vancomycin is given by intravenous route, what happens if vancomycin is given by intravenous route? It would cause excessive histamine release. It would cause excessive histamine release, and this excessive histamine release will cause vasodilation. पातो पढ़ा है ना? So excessive histamine release will cause vasodilation, leading to flushing all over, and this flushing is known as red man syndrome. So please remember the side effect, characteristic side effect seen with vancomycin is red man syndrome. So important one, gray baby syndrome, chloramphenicol. Red man syndrome, vancomycin. Important to be remembered. Okay, important ones. Apart from this, guys, vancomycin is also a drug of choice in cases of MRSA. Vancomycin is also a drug of choice in cases of MRSA, that is methicillin-resistant Staphylococcus aureus. I'll explain you about MRSA because MRSA is very much important, guys. We tend to forget it at times. I'll give you a flow chart and just draw that flow chart somewhere and you will remember it, okay? I'll finish this question. That question, as we all know, clindamycin-induced diarrhea, provisional diagnosis, pseudomembranous colitis, but they have asked what is the drug of choice. So the drug of choice we have discussed, it is vancomycin. Okay, option B, vancomycin is the drug of choice. Okay, third generation cephalosporins are the most common cause. If they would have asked about the cause, then the most common cause would have been third generation cephalosporins. Now I am explaining you about MRSA. Okay, so what happens, पहले क्या हुआ था, Staphylococcus aureus, okay, Staphylococcus aureus bacteria usually was treated with penicillins. Okay, penicillins are active against gram-positive organisms mainly. Staphylococcus aureus is a gram-positive cocci. Therefore, it was treated with penicillin. Which penicillin? It was usually treated with other penicillins. But now what happened? Staphylococcus aureus became very intelligent. It developed an enzyme, okay, which was penicillinase or beta-lactamase. वो क्या कर रहा था? It was destroying the penicillins. Therefore, we need to come up with some another agent that would not get destroyed by these beta-lactamases. And this newer penicillin, which was not destroyed by penicillinases, was penicillinase-resistant penicillin, that was methicillin. Okay, so methicillin was given in Staphylococcus aureus, but now this Staphylococcus aureus became more smarter. वो और ज़्यादा शाना बन गया और उसने क्या किया, जो penicillin binding protein होता है, okay, the penicillin binding protein which is located over here on Staphylococcus aureus, उसका म्यूटेशन कर दिया इसने. ओके, सो दैट प्रोटीन गॉट ऑल्टर्ड. सो देयर वाज ऑल्ट्रेशन. Important. Why I am telling this? Because this question has come earlier. Okay, what was the mechanism for resistance in Staphylococcus aureus? So the mechanism of resistance in Staphylococcus aureus was alteration in the penicillin binding protein. Okay, so there was alteration in the penicillin binding protein which led to a new species of Staphylococcus, that was methicillin resistant Staphylococcus aureus, which was seen. So now this methicillin resistant Staphylococcus aureus or MRSA, ये smarter bacteria था, it was not killed by methicillin, so now we had to come up with some smarter drug, and that was, in our case, it was vancomycin. Okay, so we came up with vancomycin, which was not destroyed by this highly intelligent species of Staphylococcus aureus. But अभी तो हमें पता ही है, staff is getting intelligent day by day, therefore it also developed some mechanism to for resistance against vancomycin, and this new species now it came up with was known as VRSA, that is vancomycin resistant Staphylococcus aureus. And now we are also smarter enough because we are humans, हमें ज़्यादा दिमाग होता है थोड़ा, I hope. Therefore, VRSA के लिए drug of choice क्या निकाली हमने? The drug of choice for VRSA is daptomycin. हमने देखा था cell membrane synthesis inhibitors. I told you important drug. I'll tell you somewhere in the next questions. So daptomycin is the drug of choice for vancomycin resistant Staph aureus. Okay. At times linezolid is also used, but please remember the drug of choice still remains dapto followed by line. Linezolid is only used in cases of VRSA induced pneumonia, because VRSA induced pneumonia में daptomycin could not work, therefore linezolid is used. I hope guys everything is clear. If you are still attentive, just put yes sir or just put a thumbs up to be interactive in the session. Okay, I hope this you have understood clearly and you would not make any mistake. Okay, and the last point that you need to remember about vancomycin, that you already know guys, that vancomycin is a nephrotoxic drug. We have already discussed fat PSV mein, last V was for vanco, and it is also autotoxic. Okay, it is also autotoxic. But the most characteristic side effect that you would remember is red man syndrome. Now, moving further guys, moving further with our next question, which states, which of the following antimicrobials are active against a bacteria producing extended spectrum beta lactamases? इसी की बात की हमने अभी. I've explained you the whole flow chart. What happened? There was some organism earlier This bacteria was given usually penicillins, but these bacteria become smarter. Okay, इसने क्या कर लिया, कोई एक enzyme बना ली, that was known as penicillinase. Okay, this bacteria produced an enzyme which was known as penicillinase, or also known as beta lactamase, and this enzyme is a smart enzyme which kills our penicillins. Okay, this enzyme kills our penicillins. It does not let the penicillins act on the bacteria, so bacteria is safe totally. So this bacteria is saved. But हमने क्या किया फिर, what we did was we found out a combination. What we did, so we gave a drug which was actually, thank you so much, which was actually destroying this beta lactamase. Okay, so beta lactamase destroying agent दिया हमने कोई, and normal हमने penicillin दिया. So this combination was given. Okay, a beta lactamase inhibitor was given along with penicillins. Okay, we were smarter, so we gave two drugs, beta lactamase inhibitor, so beta lactamase का काम तमाम हो जाएगा, and penicillins would act freely. Okay, एकदम खुला act कर पाएंगे वो. Okay, so this combination was given. So which are the beta lactamase inhibitors which are given? So please remember guys, the important beta lactamase inhibitors which are there with us are what? Important ones. Sorry, important ones are clavulanic acid. Clavulanic या clavulanic acid सुना होगा. Okay. Second is your sulbactam, and third is important one is your tazobactam. Okay. So the three important penicillinase or beta lactamase inhibitors are clavulanic acid, sulbactam and tazobactam. They are given along with some other penicillins, और ये combination fixed होता है. Okay, they are mostly given with a specific penicillin. तो ये combination क्या है, that you need to know. Okay, we usually use it commonly. Clavulanic acid is given with amoxicillin. Clavulanic acid along with amoxicillin. Sulbactam along with ampicillin. Sulbactam along with ampicillin, and tazobactam along with piperacillin. Tazobactam along with piperacillin. Okay, so this is the best combination that we use in cases of beta lactamase resistant bacteria. Okay, so beta lactamase producing bacteria. But out of which what happens? These of the drugs were active against beta lactamase producing bacteria, but not against extended spectrum beta lactamases. Okay, so bacteria was producing two types of beta lactamases. One was narrow spectrum, other was wide spectrum. ये narrow spectrum के against तो काम करती थी, narrow spectrum को तो खत्म करती थी, but wide spectrum के against नहीं. Therefore, the beta lactamase inhibitor combination which is active against extended spectrum beta lactamase is your option C, piperacillin tazobactam combination. It is your option C, piperacillin tazobactam combination. Okay, it is the best combination which is active against extended spectrum beta lactamases. Okay, beta lactamases के against तो सभी है, but extended spectrum के against it is pipera plus tazo. Okay, I hope you have understood this. Ceftriaxone guys, it is a third generation cephalosporin. इंपॉर्टेंट है याद रखना, कॉमनली प्रैक्टिस में मेनिंजाइटिस में यूज करते हैं. इट इज रादर द ड्रग ऑफ चॉइस इन टाइफॉइड, एंट्रिक फीवर में ड्रग ऑफ चॉइस है. ओके, नाउ लेट्स मूव फर्दर. द नेक्स्ट क्वेश्चन टू यू गाइज इज, अ पेशेंट इज प्रेस्क्राइब्ड प्रोबेनासीड अलॉन्ग विद पेनिसिलिन. व्हाट इज द रीजन बिहाइंड दिस? सो वी आर गिविंग टू ड्रग्स, प्रोबेनासिड और पेनिसिलिन. ओके, क्यों दिया जाता है? सो लेट्स सी. फर्स्ट ऑफ ऑल वील जस्ट अंडरस्टैंड द कॉन्सेप्ट क्या है. पेनिसिलिन्स क्या होता है? पेनिसिलिन्स आर बीटा लैक्टम ड्रग्स. ओके, सेल वॉल सिंथेसिस इनहिबिटर्स होते हैं. ओके, दीज आर वेरी शॉर्ट एक्टिंग ड्रग्स. ओके, पेनिसिलिन्स आर यूजुअली शॉर्ट एक्टिंग ड्रग्स because what is the mechanism of penicillin of excretion? They are rapidly secreted at the renal tubules. Okay, these are rapidly secreted at the renal tubules. As they are rapidly secreted at the renal tubules, what happens? They are immediately excreted out of the body as soon as you take them. Therefore, they are very short acting. So to make them long acting, what we need to do? We need to give up we need to give up another agent that would compete with them at this level. Okay, so what happens? We give another agent like probenacid which competes with them at the renal tubules. So renal tubules पे क्या होता है? Probenacid बोलेगा मैं जाऊँगा, penicillin बोलेगा मैं जाऊँगा. But finally who wins? Finally probenacid wins, and therefore probenacid is initially excreted out of the body. Okay, so the renal tubules are full now with probenacid, so penicillins का action, duration of action body में बढ़ गया. Okay, so this is the mechanism by which penicillins are made longer acting. Okay, so when we give probenacid along with penicillins, probenacid keeps the renal tubules busy, therefore penicillin should not be excreted or secreted out of the body, and therefore penicillins can have a longer duration of action in the body. Okay, they can have longer duration of action inside the body. I hope this is very much clear now. And what is the answer? Let's see. Option A, it is a beta lactamase inhibitor. No. It increases the duration of action of penicillin. Yes. Option B is the right answer. It increases the duration of action of penicillins. Okay, very important. It increases the excretion of penicillins in kidney. Nahi. Don't get confused, guys. मैंने क्या बोला? It competes with penicillins at the level of kidney. Okay, it competes. Rather, it itself gets excreted. याद रखना, it is itself excreted. खुद बाहर निकल जाता है. Okay, to keep the renal tubules busy. So it rather decreases the secretion. It rather decreases the excretion of penicillins in the kidney, therefore increasing the duration of action of penicillins inside the body. I hope this is very much clear now. समझ में आ गया? Don't confuse it with anything else. Okay. I hope this is clear, and now we can move to the next point, next question. That states a 25-year-old woman presents with foul-smelling, greenish frothy vaginal discharge and dysuria, that is painful micturition. You suspect trichomoniasis due to colpitis macularis-like picture on per speculum examination. Which among the following is the drug of choice in this condition? So we need to find the drug of choice. ये clear है? Okay. So हमें drug of choice के बारे में सोचना है. But let's come to a provisional diagnosis first. Rather, they have given a provisional diagnosis in the question itself that says trichomoniasis. Okay. So patient क्या है? 25-year-old woman. That is a young adult female. Okay. It is a young adult female, usually in her reproductive age group. Presents with foul smelling. Okay. Bad smelling, greenish frothy vaginal discharge है. Okay, greenish frothy vaginal discharge is very much characteristic of trichomoniasis, but we cannot still support our diagnosis. Let's see further. Trichomoniasis हम suspect करते हैं because there is colpitis macularis like picture. Okay, on per speculum examination we can see this picture, and what is this picture? It is a colpitis macularis like picture. Okay, which is known as strawberry vagina. Okay, this is known as strawberry vagina. Okay, this is usually seen or characteristic appearance of trichomoniasis. Okay, so there are three types of vaginitis. Candidiasis, that comes with creamy curdy white discharge. Okay, it is fungal cause, it is ruled out. Second is bacterial vaginosis, which comes with white discharge. Again, it is ruled out because this is a greeny discharge. And third is trichomoniasis, which comes with greenish frothy discharge along with strawberry vagina. Okay, so now we have come to a diagnosis. It is trichomoniasis. And what is the drug for trichomoniasis? We usually prefer a anti-protozoal drug. And which is the anti-protozoal drug? It is your option B, metronidazole. Very good, Preeta. Very good, Preeta. The answer over here is option B, that is metronidazole. Very good, Nishan, Kunal. Okay, so answer over here is option B, metronidazole is the drug of choice in cases of trichomoniasis. Okay, याद रखना, in trichomoniasis both of the partners are treated. I am trying to integrate OBJ over here. You will be revising this, but जितनी बार revise करोगे उतना जल्दी याद आएगा. Okay, important one. So in cases of trichomoniasis and in cases of candidiasis, both the partners are treated, whereas in cases of bacterial vaginosis only a single female partner is treated. Okay, now the drug of choice for trichomoniasis, we know it is metronidazole. Okay, fluconazole is the drug of choice for vaginal candidiasis. So याद रखना, fluconazole is the drug of choice for vaginal candidiasis. Okay, nitrofurantoin is usually used in cases of UTIs वगैरह. Okay, and mebendazole is a anti-helminthic agent, which we'll be discussing in next question. Metronidazole के बारे में important points. Metro is very common drug, very commonly used. Okay, first point is what? It is an anti-protozoal drug. It is an anti-protozoal drug. Second point, it is the drug of choice for which conditions? And this is very much important, guys. ये कहीं तो note कर लो. Metronidazole is the drug of choice for which conditions? Very much important. I am giving you. Okay, the mnemonic for this is Gita. Okay, the mnemonic for this is Gita. Okay, so please remember, metronidazole is the drug of choice in Gita, where G is for giardiasis. G is for giardiasis diarrhea. Then I is for, and also for Gardnerella vaginalis. Also for Gardnerella vaginalis. And what does Gardnerella vaginalis cause? It causes bacterial vaginosis. Okay. Then I is for what? I is for your intestinal or hepatic amoebiasis. For intestinal or hepatic amoebiasis, या hepatic abscess में, okay, we usually treat it with metronidazole. Then T is for, we have already discussed, trichomoniasis. And lastly, A is for what? A is for anaerobic organisms. A is for anaerobic infections. So please remember, metronidazole is a drug of choice in which conditions? Gita. G for giardiasis or Gardnerella vaginalis infection, that is bacterial vaginosis. I for intestinal or hepatic amoebiasis. T for trichomoniasis. And lastly, A for anaerobic infections. I hope this is very much clear. Just remember important side effect of metronidazole that on which questions have been asked previously. Metronidazole can cause disulfiram-like reaction. Okay, please remember, metronidazole can cause disulfiram-like reactions. Okay, important one. It can cause disulfiram-like reaction. Okay, I hope everything is clear to you now. Very crystal clear. Now we'll move on to the next question. I again reiterate the fact, guys, you need to read the main notes of your pharmacology. You need to follow your faculty. These would definitely help to add up to your knowledge, these all sessions of Sparks, all the revision sessions, all the discussion sessions, but you should not leave your notes, okay? Because most of the students have asked me that we only follow this. No, please remember, guys, you need to follow your core faculty notes as well, and these are for your revision purposes. Move on to our next question. Which among the following DNA gyrase inhibitor is indicated in cases of renal failure? Okay, is indicated. Matlab kya? Which of the following DNA gyrase inhibitor is safe in cases of renal failure? Ye doona hai. We have simplified the question. Now let's answer this. We have seen in the classification, DNA gyrase is an enzyme which helps in what? It helps in replication of the organism. And as this DNA gyrase enzyme would be inhibited, what happens? Replication would be inhibited, finally killing the bacteria. Okay, finally killing the bacteria. As we all know, it kills the bacteria, therefore it is one of the bevafar drugs. F kya tha? Fluoroquinolones, right? So please remember, it is a bactericidal drug. Again, it is a bactericidal drug, important one. Okay, it was a part of bevafar. So DNA gyrase inhibitors kya hote hai usually? These are quinolones drugs. Okay, so these are your quinolones drug. And quinolones drug are of two types. First is nalidixic acid, and nalidixic acid is usually a agent used in cases of UTIs, that is urinary tract infection, and the other group is fluoroquinolones, and the most important is your fluoroquinolones. Important points that you need to remember about this group now. Okay, we have been discussing about each and every group, so now let's discuss about fluoroquinolones. What are the important top points? First, fluoroquinolones are broad spectrum antibiotics. Fluoroquinolones are broad spectrum antibiotics, first point. Second, these are contraindicated in cases of pregnancy and in children. Okay, so fluoroquinolones are contraindicated in cases of pregnancy and in children because they cause some cartilage and tendon damage. Okay, so they cause some cartilage and tendon damage, therefore fluoroquinolones are contraindicated in cases of pregnancy and in children. Okay, next, they are also contraindicated in cases of renal failure. This we have also seen renal failure mein because they are nephrotoxic drugs. Okay, fact, Fe kya tha? Fluoroquinolones tha. Therefore they are contraindicated in case of renal failure because they are nephrotoxic agents. Okay, but the exceptions, which are the drugs which can be used in cases of renal failure? Okay, there might be some exceptions. So kaun se aise drugs hai among fluoroquinolones which are safe to be used in renal failure? And the mnemonic is PMT. Okay, the mnemonic is PMT, and P goes for pafloxacin, P goes for pafloxacin, M goes for moxifloxacin, and T goes for torvafloxacin. Okay, and T goes for torvafloxacin. So answer the question, guys, now. Anybody of you, just answer the question in the chat box. So please remember, fluoroquinolones, broad spectrum hai, contraindicated in pregnancy, children and renal failure. But in renal failure, 3 drugs can be given: PMT, pafloxacin, moxifloxacin and torvafloxacin. One more side effect that fluoroquinolones can lead to is phototoxicity. Tetracyclines भी cause कर रहे थे and fluoroquinolones भी cause करते हैं phototoxicity. Okay, important one. Now just 2 important drugs that you need to remember among this. Yeah, answer, guys, to this question. Just answer. I'll tell you about some few important drugs that are there in the options. So please remember, sparfloxacin is the longest acting fluoroquinolone. The longest acting fluoroquinolone is your sparfloxacin followed by moxifloxacin. Longest acting is sparfloxacin followed by moxifloxacin. Okay, important one. The next one, norfloxacin is one of the important drugs which is used usually in cases of urinary tract infection. Norfloxacin, Norflox सुना होगा बहुत बार. It is usually used in cases of UTIs, urinary tract infection. And maximum oral bioavailability, okay, maximum oral bioavailability is seen with levofloxacin. Maximum oral bioavailability is seen with levofloxacin. Very good, Nishan. Very good, Apurva. Very good, Veer. Very good, Zephyster. Yes, the answer over here is option A, moxifloxacin. Okay, PMT, moxifloxacin is safe to be used in cases of renal failure. No dose reduction is required. Okay, क्या पूछ सकते हैं, बस अलग करके पूछ सकते हैं ना, which of the fluoroquinolones will not require dose reduction? Again the same thing, which of the fluoroquinolones is safe in cases of renal failure? Again the same thing, which of the fluoroquinolones is indicated in cases of renal failure? Again the same thing, right? So please remember, whatever the question is twisted, however it is twisted, you need to answer it correctly now. Okay, yaad rakhna hai. Moving further to our next question. A patient complains of fever, one-sided facial pain, diplopia, black nasal discharge and brownish black spots on the palate. He gives history of recovering from COVID a week ago. Which is the most appropriate drug for this patient? मुझे तो लगता है इसमें तुम्हें ऑप्शन की भी जरूरत नहीं है, तुम अपने आप आंसर करोगे. Okay, so please remember, what is the condition which is very much in fashion right now? बहुत ज़्यादा चल रहा है फिलहाल कोविड के बाद. So they are talking about some post-COVID complication. Okay, he has a history of recovering from COVID a week ago just. Okay, so they are definitely talking about some post-COVID complication. Okay, so a very important post-COVID complication which presents with all these features: fever, one-sided facial pain, diplopia, that is double vision, black nasal discharge and brownish black spots. Black nasal discharge and brownish black spots जो इस पिक्चर में ऑलरेडी दिए गए हैं तुम्हें. What are these? These are very much suggestive of which post-COVID complication? They are very much suggestive of mucormycosis. So please remember, they are very much suggestive of mucormycosis, guys. And mucormycosis is the most important thing that you need to remember. Mucormycosis is due to a mucor fungi. Okay, it is due to mucor fungi. And therefore we need to use some antifungal agent, and all of the options given are antifungal agent. So ऐसा तो सोचो मत कि rule out करेंगे उस हिसाब से. So all of the options are antifungal. So which is the drug of choice? They are asking most appropriate drug. मतलब वही drug of choice they are asking. Very good, Nishant. The answer over here is option B, liposomal amphotericin B. The answer over here is option B, liposomal amphotericin B. So please remember, LAMB or liposomal amphotericin B is the drug of choice in severe fungal infections. It is the drug of choice in cases of severe fungal infections like mucormycosis. Okay, important one. Okay, याद रखना ये very important है. Then second point you need to remember, it is a cidal drug. It is a fungicidal drug. It kills the fungus. Okay, please remember, it is a fungicidal drug. It kills the fungus. Now a question was asked in AIIMS, and that can also be asked in our exams also. Which is the most common side effect seen with amphotericin B? The most common side effect seen with amphotericin B is, anybody? Those are infusion related reactions. Or infusion related है मतलब क्या? It is not a oral drug, it is a IV drug. So please remember, amphotericin B is usually given by which route? It is usually given by intravenous route, and therefore the most common side effect of amphotericin B is infusion related reaction. Important point to be remembered. Okay, ये याद रखना है. Other side effects of LAMB are, the other important side effects of LAMB we have discussed. It was one among the fat PSV. Okay, it was one among the fat PSV. मतलब it is a nephrotoxic drug. It is a nephrotoxic drug. Important. And it also causes bone marrow suppression. It also causes bone marrow suppression. One question came that liposomal amphotericin B acts at which level of the fungal cell? It acts at which level of the fungal cell? Anybody? Please guys, anybody if can answer. A chocolate is fixed. Whenever we meet in class very soon, chocolate ले लेना मेरे से याद करके. Anybody answering this question? Liposomal amphotericin B acts at which level of the fungus? Acts at which level of the fungus? कहाँ काम करता है? LAMB. On which part of the fungus? Tell me this, okay? Till that I'll tell you. I have already told you that liposomal amphotericin B is the drug of choice in severe fungal infections like mucormycosis and also in cases of Kala Azar. Important in PSM or microbiome. It is also a drug of choice in cases of Kala Azar, that is visceral leishmaniasis. Okay, important one. Whereas all these other drugs that you can see, azole, that is itraconazole or ketoconazole, or important drug that is fluconazole. As we have discussed about fluconazole, it is a drug of choice in vaginal candidiasis. Okay, so please remember, fluconazole is a drug of choice in all candida or other fungal infections like cryptococcus. Okay, so please remember, in mild to moderate fungal infections, fluconazole is a drug of choice. In mild to moderate fungal infection, fluconazole is a drug of choice like in candida albicans or cryptococcal infections. Important one. Okay. And terbinafine is usually used in cases of dermatophysis. Okay, so please, phytosis. Terbinafine is a drug of choice in cases of dermatophytosis, like tinea infections. Okay, all the tinea infections are dermatophytosis, right? So terbinafine is a drug of choice in cases of dermatophytosis. Okay, like tinea. Tell me, liposomal amphotericin B usually acts at the level of cell membrane. Very good, guys. It acts at the level of cell membrane. Yes, it inhibits ergosterol synthesis. Very good. I'm very happy. So Mukesh and Ahish, both of you, that Krishna, Ahish and Mukesh, both of you deserve a chocolate. अगली बार मिलोगे तो ले लेना वैसे. So please remember, cell membrane synthesis inhibitors is your liposomal amphotericin B. Important question. Need to remember this at any cost. Okay. I hope now all the antifungal drugs, important ones, you have discussed over here. One more point. Azole drugs जो होते हैं, okay, azole drugs are fungi static drugs. They just inhibit the growth of the fungus. They do not kill the fungi. Fungi is only and only killed by your liposomal amphotericin B. Okay, and also terbinafine. Terbinafine is also a cider drug. Okay, so azole group of drugs are static drugs. Now moving on to our next question, guys. That mentions which of the following drug can cause contraceptive failure in a lady on oral contraceptive pills. Okay. So a lady is taking oral contraceptive pills, and which of the following drugs would cause contraceptive failure? So now let's discuss it point-wise. OCPs, that is your oral contraceptive pills, are metabolized by what? These are metabolized by which enzymes? These are metabolized by microsomal enzymes. Okay. As we know, microsomal enzymes are inside the endoplasmic reticulum. So these microsomal enzymes either can be induced or they can be inhibited. Okay. So these microsomal enzymes either can be induced or inhibited. So there are some drugs which can induce this enzyme. There are some drugs which can inhibit this enzyme. So let's see this first. For example, some drug is inducing microsomal enzymes. So क्या होगा usually? So drug A and drug B are both given. Okay. Drug A is a microsomal enzyme inducer. What happens? What happens is, now the metabolism would be increased. As it is inducing the microsomal enzymes, the metabolism of drug B would be increased, and the drug B would be rapidly excreted out of the body. The drug B would be rapidly excreted out of the body, and therefore it can lead to failure. Okay, effectivity nahi aayegi. Okay, so please remember, there would be no effectivity seen because the drug B would be rapidly excreted out of the body. Okay, because the other drug given along with it is an enzyme inducer. But in cases of enzyme inhibitors, what happens is, now suppose drug A is an enzyme inhibitor. It is inhibiting the enzyme. Microsomal enzyme is inhibited. Therefore, drug B would be not metabolized at all. It would keep on accumulating inside the body. And excess of accumulation inside the body would cause what? It would cause toxicity. And this concept we have already discussed in general pharmacology. Okay, two mnemonics I have already given you. Inducers are GPRS cell phone, and inhibitors are your vitamin K cannot cause cell inhibition. Okay, so please remember these 2 points I have already given you. You can refer to the general pharma video for this thing. Okay, so now I'll be telling you just about the important points over here. And what are those? In this case, what has happened? There is a contraceptive failure which is seen. Okay, there is a contraceptive failure which is seen, and it is due to some enzyme inducer which is given along with oral contraceptive pills. And which is the enzyme inducer which is given along with oral contraceptive pills? Those are your GPRS cell phone, where G stands for what? Griseofulvin, which is an antifungal drug. Very good, Veer. The answer over here is option B, Griseofulvin, which is an antifungal drug, which is an enzyme inducer. It will increase the metabolism of oral contraceptive pill, rapidly excrete it out of the body, bahar phek dega usko, and then that would lead to contraceptive failure. So therefore option B, Griseofulvin, is your answer over here. Whereas ketoconazole and isoniazid, both of these are microsomal enzyme inhibitors. Okay, both of these are microsomal enzyme inhibitors. If any of these drugs will be given with it, then kya hoga? Toxicity would be seen. Okay, important one. Very good. Now let's move on to our next question that states, a child was diagnosed with as a case of abdominal cocks. And what is abdominal cocks? That is gastrointestinal or abdominal tuberculosis. Robert Koch discovered TB bacteria, therefore it is also known as abdominal cocks. Commonly यही term हम use करते हैं clinical practice में. It is abdominal cocks. and was started on ATD, that is anti-tubercular therapy. Now she complains of inability to recognize red and green color properly. The likely drug responsible is. इसका तो आंसर चाहिए यार. This is a very easy question which has been asked repeatedly. So just tell me, which is the drug which can cause this side effect, that is red and green color blindness. So please tell me, which is the drug, anti-tubercular drug, which can lead to red and green color blindness. All of these are your first line tubercular agents. So I'll just tell you a few points about ATT. Anti-tubercular therapy is started with first line agents, and first line anti-tubercular agents are what? HRZES. S stands for isoniazid, R for rifampicin, Z for pyrazinamide, E for ethambutol, and S for streptomycin. Streptomycin के बारे में we have already discussed important points. It belongs to aminoglycoside group of drugs. एक point याद रखना, the only injectable first line anti-tubercular drug is streptomycin. This question had come. The only injectable anti-tubercular drug which is first line is streptomycin. So important one is this, okay? याद क्या रखना streptomycin के बारे में? Only injectable first line anti-tubercular agent, okay? Whereas ethambutol, all the other drugs are bactericidal, okay? All of the other drugs kill the Mycobacterium tuberculosis except ethambutol, because ethambutol is a bacteristatic drug. It just inhibits the growth of Mycobacterium TB, okay? So all the rest first line agents are bactericidal except ethambutol, which is bacteristatic, okay? Very good guys, the answer over here is option A, ethambutol. So please remember, red-green color blindness is a very characteristic side effect seen along with ethambutol. Okay, red and green color blindness is a very characteristic side effect seen along with ethambutol. Okay, these are the two most important points that you need to remember about ethambutol. That is, it is the only bacteristatic drug, and second, it causes red and green color blindness. Okay, we have discussed about isoniazid in details, streptomycin, ethambutol. Pyrazinamide. What is the important point about pyrazinamide that only you need to know? Those are your two side effects of pyrazinamide. Pyrazinamide is the most hepatotoxic anti-tubercular agent. So please remember, the most hepatotoxic first line anti-tubercular agent is pyrazinamide. Okay, most hepatotoxic. And second, it causes hyperuricemia, predisposing the patient to gout. Okay, it causes hyperuricemia, predisposing the patient to gout. Two important side effects of pyrazinamide. It is the most hepatotoxic agent, and second, it can predispose the patient to gout. Now we are just left with one most important agent, and that is rifampicin. Okay, that is rifampicin. Important features about rifampicin I will be telling you guys. First, rifampicin is safe in cases of renal failure. Okay, so please remember, rifampicin is a anti-tubercular drug which is safe in cases of renal failure. Why? Because it is again excreted via bile. It is excreted via bile. Which was the another drug which was excreted via bile? Doxycycline, right? So doxy and rifampicin both are excreted via bile. Therefore, these drugs are safe in cases of renal failure. Rifampicin is an enzyme inducer. Okay, हमने देखा ना, enzyme inducers can lead to failure of another drug. So rifampicin is also one of the microsomal enzyme inducers. Okay, याद रखना. Sorry, inducers है. Okay, it is a microsomal enzyme inducer. And a characteristic side effect seen with rifampicin, it causes orange discoloration of the urine. It causes orange color urine होगी. Okay, so please remember, orange color की urine किस drug के साथ दिखती है? It is usually seen with rifampicin, and it can also cause staining of your contact lenses. It can stain your contact lenses orange वगैरह. Okay, so staining of contact lenses is also seen. So please remember important points about rifampicin. It is excreted via bile, so safe in renal failure. It is an enzyme inducer, and it causes side effect orange discoloration of urine and staining of contact lenses. Okay. Last point, ATT के बारे में. ATT is usually given for how much time? So please remember, anti-tubercular therapy is usually decided according to the category of patient, but now unanimously we say that it is usually given for a period of 6 months. It is usually given for a period of 6 months, out of which 2 months is the intensive phase. Okay, 2 months is the intensive phase, and 4 months is the continuation phase. 4 months is a continuation phase. Where which drug would be skipped out? Streptomycin is skipped out. Okay. HRZE is only given. पहले HRZE तीनों दिए जाते हैं, and second इसमें HRZE given. Okay, only. Okay. So please remember this. Now moving to our next question, guys, which states a child's fecal sample microscopy. Okay, a child's fecal sample microscopy showed presence of Ascaris lumbricoides X. This condition is most effectively treated with. So as we all know, Ascaris lumbricoides is what? Ascaris lumbricoides is a helminth. So they are actually asking us about what? Anti-helminthic drug. And about which condition? Ascariasis. So Ascaris lumbricoids एक दिखे हमें fecal microscopy पे. Now this condition is most effectively treated with what? So drug of choice for Ascariasis they are asking in short. Okay. So now let's see the classification. Okay, for anti-helminthic drug. Just remember this anti-helminthic drug classification, and there you are. You know, like you would know most of the things. Okay. So helminths are usually divided into what? Helminths are usually divided into three categories. First being, according to pharma, I'm telling you, they are divided as tapeworms, they are divided as flukes, and they are divided as nematodes. Okay, so please remember, tapeworms and flukes are your platyhelminths, that is flatworms, and nematodes are your roundworms, hookworms, pinworms, all of them. Okay, all of the rest are your nematodes. Important one. So now we'll see what is the drug of choice for tapeworms. So please remember, the drug of choice for your tapeworms is praziquantel. The drug of choice for your tapeworms is praziquantel. There is exception. Okay, so there is one exception, and what is that exception? Please remember, in dog tapeworm. Okay, what is dog tapeworm? Dog tapeworm is Echinococcus granulosus. It is Echinococcus granulosus which causes hydatid cyst. Okay, right? So Echinococcus granulosus or dog tapeworm which causes hydatid cyst. In that condition, praziquantel is not the drug of choice. In that condition, albendazole is the drug of choice. In that condition, albendazole is the drug of choice. Exception, one exception to be remembered. Second, in flukes, what is the drug of choice in flukes? So please remember, in flukes again the drug of choice is praziquantel. Again one exception, and what is the exception over here? It is your liver fluke. Liver fluke, also known as fasciola hepatica. In fasciola hepatica or liver fluke, the drug of choice would be triclabendazole. The drug of choice would be triclabendazole. And lastly, now talking about nematodes. Nematodes mein drug of choice kya hai? So please remember, the drug of choice in nematodes is albendazole. The drug of choice in nematodes is albendazole. And what is the exception? So there are two exception, important ones to be remembered. First is filariasis. Okay, filariasis, that is elephantiasis वगैरह तुम्हारा, for which the drug of choice is DEC, that is diethyl carbamazine. And second is your onchocerciasis. Onchocerciasis is also known as river blindness. Onchocerciasis is also known as river blindness. And onchocerciasis में drug of choice क्या है? It is ivermectin. Also for strongyloids infection, it is ivermectin. Okay, so please remember. Now I'll just revise it once again. Anti-helminthic drugs. Drug of choice for tapeworms, praziquantel. Exception, dog tapeworm or Echinococcus granulosus, for which it is albendazole. Next, flukes. Drug of choice is praziquantel. Exception, liver fluke or fasciola hepatica, for which the drug of choice is triclabendazole. And last option, last, that is nematode group. Okay, roundworms, hookworm, pinworms, all of those. For that, the drug of choice is albendazole. Exception being filariasis, for which the drug of choice is DEC, diethyl carbamazine. And lastly, onchocerciasis and strongyloid infection, for which it is ivermectin. I hope everything is clear now. So Ascariasis belongs to which group? Ascaris belongs to nematode group. It is a hookworm. Okay, it belongs to which group? It is a giant roundworm which belongs to nematode group. And the answer over here is option C, albendazole. So please remember, the answer over here is option B, option C, albendazole. Okay, albendazole is the drug of choice in cases of Ascariasis. I hope everything is clear. Now we'll move on to our next question, and which states, diethyl carbamazine is used to treat which among the following conditions? Easy now. Now I would wait for the answer, guys. I have told you. Okay, I have told you everything. Just tell me the answer over here now. Diethyl carbamazine, that is DEC, is used to treat which among the following conditions? Now I'm waiting for the answer. Answer, please. So, we have already discussed about Ascariasis. Here the drug of choice is what? Here the drug of choice was albendazole. Okay. We have discussed about onchocerciasis. There the drug of choice was what? Ivermectin. And the last two options are left now. Please tell me, either filariasis or dracunculiosis. Dracunculiosis does not have a specific drug to act against it. So please remember, the answer for this condition would, this question would be, please tell me option A, filariasis. So please remember, filariasis ke against it is your diethyl carbamazine which is effective. So DEC or diethyl carbamazine is effective against filariasis. It is effective against filariasis. Okay. Filariasis can be of two types. Either it can be very good, important. Nishant and Bhavna. Sonali. So please remember, filariasis can be either lymphatic or Bancroftian filariasis caused by Wuchereria bancrofti, or it can be Bruggian filariasis caused by Brugia malai. Okay, important one. On this lymphatic or Bancroftian filariasis would what? It would manifest as elephantiasis, for which the image came in June 2021 session, and it was asked in which sample we cannot find microfilariae. And it was the answer was saliva. We have discussed this earlier, right, in the recall questions. If you are not seeing the recall, you can see the recall. Okay. Now, moving further, I can move further with the next question, which states, a child presented with fever and after few days rashes appeared all over the body. Okay, these are the purpuric rashes which are seen. Okay, all these are purpuric rashes which are seen. The case was diagnosed as meningococcal infection, right? Which is the preferred drug? Matlab again, drug of choice ढूंढनी है, but which is the preferred drug used as prophylaxis for this condition? Okay, which is the preferred drug used as prophylaxis for this condition? Okay, now what we need to know, we are finding the drug of choice for prophylaxis and not for treatment. ये याद रखना is very much important. So now let's discuss something about meningococcal infection. As we all know, meningococca is what? Meningococca is a gram-negative cocci. Okay, so please remember there are only 2 gram-negative cocci, mainly meningococci and gonococci. Okay, so meningococci के बारे में क्या पूछना है हमें? Let's see. Meningococci infections usually start with fever, and then there are generalized purpuric rashes all over the body. Okay, this is a characteristic appearance. Meningococcal infections can be empirically treated. And empirical treatment is what? Empirical treatment is usually given in suspected cases. जिनमें हमें लग रहा है, if we suspect meningococcal infection, in those cases we give empirical therapy. And the drug of choice for empirical treatment in meningococcal infection is a 3rd generation cephalosporin, that is your ceftriaxone. That is your ceftriaxone. So drug of choice for empirical treatment in suspected cases is ceftriaxone. Drug of choice for definitive treatment is, definitive treatment means diagnosed cases. If here what they have mentioned, the case was diagnosed, matlab this is a diagnosed case, but they have not asked about the definitive treatment. They have not asked about the treatment. So this cannot be the answer. Okay, so please remember. Now they are asking about the definitive treatment. So definitive treatment mein drug of choice kya hoga? So for definitive treatment, the drug of choice is penicillin G. So please remember, the drug of choice for definitive treatment is penicillin G. And lastly, which is the drug of choice for prophylaxis? So here we are. Okay, so please remember, which is the drug of choice for prophylaxis of meningococcal infections? So please remember, the drug of choice for prophylaxis of meningococcal infection, we usually use 3 drugs for prophylaxis: ciprofloxacin, rifampicin and ceftriaxone. But the drug of choice in this condition would be ciprofloxacin. So please remember, ciprofloxacin, which is a fluoroquinolone, is a drug of choice for prophylaxis of meningococcal infection. Why? Because in mass chemoprophylaxis, where you need to give chemoprophylaxis to a whole community, oral drugs are preferred over intravenous or any other IV or IM drugs. Okay, so as we all know, rather than injectables, oral drugs are preferred, and ciprofloxacin is an oral drug, and therefore it is preferred as a drug of choice for prophylaxis of meningococci. Ceftriaxone is an injectable drug, as we all know this, right? So please remember, drug of choice for chemoprophylaxis of meningococci, ciprofloxacin. But if they ask about pregnancy or in children, so as we all know, ciprofloxacin or fluoroquinolones are usually contraindicated in pregnancy or children because they cause some cartilage or bone damage. Therefore, we cannot use ciprofloxacin now. So, in pregnant or children's, what is the drug of choice in meningococcal infection prophylaxis? It is your 3rd generation cephalosporins, that is your ceftriaxone. So please remember, ceftriaxone would be preferred in cases of pregnancy and in children because it is a safer drug. Okay, it is a safer drug. I hope now. So now, yes, this is a child they have told, right? Okay, this is a child in this condition they have told, but they have not mentioned that specifically about this condition. If they mention about this condition, then the answer should be ceftriaxone over here. But if they are asking about meningococcal infection as a whole, then the answer should be option A, ciprofloxacin. Okay, if they are asking about meningococcal infection as a whole, then the answer should be ciprofloxacin. If they specifically ask about pregnancy or children, then the answer would be ceftriaxone. Okay, moving further to our next question, guys, which states that a patient was started on multibacillary leprosy treatment or regime. Which among the following statement is false about the regime? So now we are discussing some important points about leprosy. Leprosy is also known as Hansen's disease. There are two types of regime which are used in treatment of leprosy. One is your multibacillary leprosy regime and second is your paucibacillary leprosy regime. Okay, both of these are same. Okay, both of these are same, typically same. सब कुछ चीजें इनमें same है, everything is same. The treatment, the drug, everything is same. Okay, so the treatment regime is same, the drugs used is same, the dose used is same. So what is the difference? So please remember, the duration is different. Okay, so please remember, in multibacillary leprosy it is usually preferred in lepromatous leprosy. Okay, in those cases the duration of treatment would be 12 months, whereas paucibacillary leprosy, which is usually given in milder leprosy like borderline or tuberculoid leprosy, the duration of treatment would be 6 months. Okay, so multibacillary leprosy treatment regime for 12 months, paucibacillary leprosy treatment regime for 6 months. This is the only difference, guys. Okay, so I'll just brief you about important points about this MBL or PBL regime of leprosy. In this, what happens, we usually give 3 drugs. Okay, and what are these 3 drugs? First is rifampicin 600 mg. It is given once monthly. Okay, it is given once monthly. Second drug is clofazimine. Okay, which is given 300 mg, again once monthly. Okay, it is again given once monthly. And the other 2 drugs are, first is again clofazimine, but this time it is given 50 mg. Now this time it is given 50 mg once daily OD, and next is your dapsone. Okay, dapsone, which is given 100 mg once daily. Okay, so as we all know, rifampicin 600 mg and clofazimine 300 mg, they are given once monthly. These are supervised doses. They are to be taken in presence of a healthcare worker. मतलब तुम्हारे सामने तुम खिलाओगे. Okay, खा ले ये rifampicin and clofazimine. Whereas these rest drugs, they are given for total 28 days. Okay, they are given for total 28 days or 1 month, and these are unsupervised doses. Okay, so now what is the wrong statement? We'll see statement by statement. Rifampicin and clofazimine supervised dose are given once monthly. Yes, the statement is right. Dapsone is started 100 mg once daily. Yes, it is right. The duration of regime is 6 months. What they have told? Multibacillary leprosy. And for multibacillary leprosy, the treatment regime is for how many months? It is for 12 months and not for 6 months. Okay, so this is the wrong statement. So the answer over here is option C, that is the duration of multibacillary leprosy regime is 12 months and not 6. And clofazimine can lead to pigmentation. Yes, a characteristic side effect of clofazimine is pigmentation. Okay. Rifampicin is used in cases of meningococcal meningitis and Haemophilus influenza type B for as a prophylaxis, but it is not the preferred drug nowadays. Okay, better results are seen with ciprofloxacin. Okay, and it is an oral drug, so it is commonly used. Okay, I hope this has answered your query, Krishna. So now moving to our next question, guys, which states a HIV positive patient, okay, was diagnosed. HIV positive patient was diagnosed with CMV retinitis. What is CMV? That is cytomegalovirus retinitis, which is the drug of choice in this condition. So we need to find the drug of choice for CMV infection or drug of choice for CMV retinitis. Easy. Now we have simplified the question. Okay, as we all know, CMV, what is CMV? It is human herpes virus 5. Okay, human herpes virus type 5. And what are the characteristic appearance? We can see owl eye inclusion bodies in this. Okay, owl eye inclusion bodies are seen. And CMV retinitis is a retinal infection characteristically seen in HIV positive patients. But कब दिखता है? So please remember, CMV retinitis is seen in HIV positive individuals when the CD4 count goes below 50 cells. Okay, when the CD4 count is less than 50 cells, then the most common opportunistic infection seen is CMV retinitis. You might have studied now, the most common opportunistic infection in HIV is TB. Okay. So please remember, the most common opportunistic infection in HIV is usually TB if we talk about India, and if we talk about the world, it is Pneumocystis carinii or Pneumocystis jirovecii pneumonia, right? Wo chhod do, we'll discuss it in some other topic. Just remember this, that CMV retinitis is usually seen, or it is the most common opportunistic infection in HIV positive individuals when the CD4 count is less than 50 cells. Okay. Now, what is the drug of choice? Anybody? Yes, very good, Krunal. The answer over here is option B, ganciclovir. So please remember, ganciclovir is the drug of choice in cases of CMV retinitis or any of the CMV infections. Then what is acyclovir? Acyclovir belongs to the same group, the antiviral group. as ganciclovir. But acyclovir is used in which infection? It is used in the very common fungal infections, very common viral infections, and that are herpes simplex virus, HSV1 and HSV2. As you all know, HSV1 causes infection above the waist, mostly oral herpes, and HSV2 causes infection below the waist, mostly genital herpes. ये याद है ना? So HSV1 and HSV2 में usually we use the drug of choice is acyclovir. Okay, acyclovir is also a drug of choice in HHV3, and human herpes virus 3 is what? Varicella zoster virus. Okay, varicella zoster virus, or your chicken pox virus. So please remember, in chicken pox or in herpes simplex virus, the drug of choice would be acyclovir. Okay, important one to be remembered. Then just remember about oseltamivir. Oseltamivir is a drug of choice for which viral infection? Oseltamivir is a drug of choice for influenza. Okay, it is a neuraminidase inhibitor. Okay, it acts against the neuraminidase spike protein of influenza. Okay, it is usually used or drug of choice against influenza. Okay, in swine flu or avian flu it is used. Okay, and कितना dose दिया जाता है? 75 milligram once daily is the dose. Okay, 75 milligram OD. Okay, usually was used in cases of influenza infections. Oseltamivir, ये question पूछा गया है, so please remember this. Oseltamivir question आया है. Tenofovir. Okay. So just remember, tenofovir is a drug used in cases of hepatitis B. Okay, so please remember, tenofovir is an antiviral drug used in cases of hepatitis B. So hepatitis B we usually treat with lead drugs. And what are the lead drugs? L goes for lamivudine, E goes for emtricitabine. Okay, emtricitabine, and T goes for tenofovir. So lamivudine, emtricitabine, and tenofovir are the 3 lead drugs used in cases of hepatitis B infection. I hope this is very much clear now. Let's move on to our next question. That states efavirenz used in heart. What is heart? It is highly active antiretroviral therapy. It is highly active antiretroviral therapy. And this is used against which infection? Yes, it is used against HIV. So please remember, highly active antiretroviral therapy is used for what? AIDS, HIV AIDS. Okay, heart. So efavirenz used in cases of hearts act by which of the following mechanism? So what do we need to find? We need to find the mechanism of action of efavirenz, which is used usually in heart. Okay. So now let's see. Just prior to answering this question, I would like you guys to know about the important anti-HIV drugs. Okay, I would like you guys to know about the important anti-HIV drugs. Okay, just important one. I had actually included a table which is just missing now. So I'll just tell you about the 5 groups of anti-HIV drugs. So first group is your fusion inhibitors. Okay, first group is your fusion inhibitors, which inhibits the fusion of the virus along with the normal cell. So these fusion inhibitors, naam yaad rakh lo, these are enfuvertide. Okay, the drugs are enfuvertide or maraviroc. The drugs are enfuvertide or maraviroc. Important. Second group of drugs is your nucleoside or nucleotide reverse transcriptase inhibitors. Nucleoside or nucleotide reverse transcriptase inhibitors, and these drugs are zidovudin. Important drugs I am telling you. Lamivudin. Okay, entecavir or emtricitabine. Okay, emtricitabine, abacavir, and tenofovir. Okay, I'll send you this chart, guys. Okay, I'll send you this proper chart afterwards. Then the non-nucleotide reverse transcriptase inhibitors are what? Non-nucleotide reverse transcriptase inhibitors. Important ones to be remembered are efavirenz, and second one would be your nevirapine. I'm just giving you important drugs. Okay, efavirenz and nevirapine. And last, the fourth group is what? Integrase inhibitors. Okay, integrase inhibitors. And what are these integrase inhibitors? Important drugs which are commonly used nowadays for prophylaxis. So these are your raltegravir and dolutegravir. Okay, raltegravir and dolutegravir. And the last group is your protease inhibitors. Last group is your protease inhibitors. All your gravis. Okay, so protease inhibitors, all your navirs which are there. Whichever navirs you will find, those are all your protease inhibitors. Okay. Now let's come back to our question, guys. Now. So efavirenz used in heart acts by which of the following mechanism? All of you know now. It acts by which mechanism? Efavirenz is a option D, non-nucleotide reverse transcriptase inhibitor. Okay, it acts by inhibiting the non-nucleotide reverse transcriptase enzyme. Sorry. Okay, so efavirenz acts by NNRTI. Efavirenz is a NNRTI. Okay, clear with this? Okay, so just important 2 points about heart. Okay, heart, that is your highly active antiretroviral therapy. 2 points are important. First, that it is started irrespective of the CD4 count. Okay, important एक question आया है बार बार, इसलिए I am telling you guys. Okay, heart is started irrespective of the CD4 count. Usually prior there was a cutoff criteria which was given, but now there is no cutoff criteria. So please remember, heart is usually started irrespective of your CD4 count. कितने भी CD4 count होने दो, you need to start heart as soon as possible. And second, heart is given as a lifelong therapy. Heart is given as a lifelong therapy. Important points. Now we are done with this question. Moving further to our next question. An intern, ये तो यार तुम्हारी लाइफ में बहुत common है. Let's see what is it. An intern posted in medicine was inserting a cannula to a HIV positive patient, and she got pricked by herself. Okay, what shall be the duration of post exposure prophylaxis? Okay, what shall be the duration of post exposure prophylaxis? And this is the reason why you need to be very much careful. Needle prick injuries are very much common during internship days. Okay, so याद रखना, you need to be very cautious while doing any of the invasive procedures. So insert got herself pricked by a HIV positive patient. Now, what is the duration of post-exposure prophylaxis? So as we all know, the post-exposure prophylaxis in cases of HIV that we know, it should be started when? So please remember, I am asking, it should be started when? The onset I am asking. So please, starting of the post-exposure prophylaxis should be within 72 hours. Okay, it should be within 72 hours. That is, the best answer would be as soon as possible. The best answer for onset of post-exposure prophylaxis would be as soon as possible. But if there is a cutoff asked, then it should be less than 72 hours. Okay, it is most effective within 72 hours. Okay, but the duration, it differs. The duration, मतलब कितने time के लिए देना है post exposure prophylaxis? The duration differs. The duration of post exposure prophylaxis in HIV positive individuals is 4 weeks or 28 days. So please remember, the duration of post exposure prophylaxis is 4 weeks or 28 days. So please remember guys, it is 4 weeks. एक महीना देते हो usually. Okay, it is given. And which are the drugs used? So please remember, the drugs used for post exposure prophylaxis are tenofovir plus lamivudine plus efavirenz. Okay, so you usually use what? 3 drugs. Usually 3 drugs are given in heart also, in post exposure prophylaxis also. Minimum 3 drugs are to be given. Okay, 2 of them should be your nucleotide reverse transcriptase inhibitors and others should be your protease inhibitors वगैरह. Okay, so the post exposure prophylaxis drugs are 3. Again, lead drugs याद रख सकते हो, lamivudine, efavirenz and tenofovir. Important drugs. Okay, duration is 4 weeks or 28 days. Started within 72 hours or as soon as possible. Okay, so the answer here would be option C, 4 weeks, because they are asking about duration. If they would have asked about onset, then your answer would have been 72 hours. Okay, important. I hope now everything is clear to you. Just I'll tell you about vertical transmission because the question has been asked. Okay, so vertical transmission is what? Infection transmission from mother to child. Okay, जब mother से माँ से बच्चे में infection transmit होता है, this is known as your vertical transmission. Okay, so vertical transmission के लिए, if a mother is HIV positive and if she is pregnant, to prevent vertical transmission of HIV, what are the drugs given? So please remember, mother is given a full heart. Okay, mother is given a total heart, that is highly active antiretroviral therapy. But the baby should be given what? Baby should be given either nevirapine or he or she can be given zidovudine. So please remember, the preferred drugs for preventing vertical transmission in HIV positive mothers are nevirapine or zidovudine. And what is the duration? It is 6 weeks. Minimum 6 weeks के लिए देना है and the baby. Moving further to our next question guys, which states, which among the following drug is used in cases of XDR TB? XDR, it is your extensive, okay, XDR, it is your extensive drug resistance TB. Okay, it is your extensive just a minute, it is your extensive drug resistant TB. Okay, so XDR is your extensive drug resistance TB. There can be different types of resistance which are seen nowadays in tuberculosis: multi-drug resistance, polydrug resistance. Okay, so what is multi-drug resistance TB? MDR TB. So please remember, MDR TB is when the tuberculosis bacteria has resistance against the two important first line drugs that are your isoniazid and rifampicin. What is MDR-TB? Bacteria having resistance against isoniazid and rifampicin. What is XDR-TB then? So please remember, XDR-TB is the species of tuberculosis which have resistance against isoniazid plus rifampicin plus one of the fluoroquinolones or at least one of the injectables. So there is resistance against 3 drugs in extensive drug resistance TB. Okay, and what are those 3 drugs? First are the 2 important drugs. First is isoniazid, second is rifampicin. So this is MDR. But if there is resistance to one more drug, either one of the fluoroquinolones or one of the injectables like amikacin, kanamycin, capreomycin, one of these, okay, then it is considered an extensively drug resistant TB, and which is a new drug. Usually in cases of MDR or XDR TB, new drugs are given, and which are the new drugs used. So please remember, the new drugs which are given are, any answers in the chat box? No answers? Option B, no. Please remember, the new drugs which are used in cases of MDR or XDR TB, those are delaminid. First answer is delaminid, second is your bedaquiline, and third is your pretomanid. So please remember, the 3 new drugs which are used against MDR or XDR TB are delaminid, bedaquiline and pretomanid. Bedaquiline pe a question has been asked prior, therefore I have included this question. So please remember, option A, bedaquiline is the new drug which is used in cases of MDR or XDR TB. Other 2 are delaminid and pretomanid. I hope everything is fine now. Linezolid, as we all know, I have told you, usually in cases of vancomycin resistant Staphylococcus aureus, the drug of choice is daptomycin. But in cases of Varsa pneumonia, as daptomycin is inactivated in the respiratory system by the surfactant, okay, daptomycin काम नहीं करता respiratory system में, therefore in Varsa pneumonia only the drug of choice would be linezolid. Okay, capreomycin is an injectable second line antitubercular agent. Okay, gatifloxacin is again oral fluoroquinolone. Now the next question is, a patient was started on therapy for ulcerative colitis, but the patient experiences generalized weakness, fatigue and pallor. What is the likely cause? I know guys, this question have been somewhat difficult for you now. Okay, this is an indirect question, but just I have included it, okay, just to make you acquainted with any of these strange questions that come your way. Okay, exam हमेशा ऐसा ही रहेगा, कुछ questions बिल्कुल ही नहीं आते होंगे, कुछ questions easily हो जाएंगे और कुछ questions पे दिमाग चलाना पड़ेगा. Okay, याद रखना, ऐसा ही होगा exam next. So please remember guys, in cases of ulcerative colitis, now here you need to know the drug of choice for ulcerative colitis first. So what is the drug of choice for ulcerative colitis? It is your sulfasalazine. The drug of choice for ulcerative colitis is your sulfasalazine. And sulfasalazine belongs to which group of drugs? It belongs to sulfonamide group of drugs. So please remember, sulfasalazine belongs to which group of drugs? It belongs to sulfonamides. And as we all know, we'll discuss some important points about sulfonamides. We know what are sulfonamides? These are anti-metabolite drugs. मैंने classification के time बता दिया था, sulfonamides are also known as anti-metabolite drugs, or all the folic acid synthesis inhibitors, they are known as anti-metabolite. So हमें पता है sulfonamides what it does. So it inhibits folic acid synthesis. What it does? It inhibits folic acid synthesis. And it inhibits which enzyme? It inhibits FAS, that is folic acid synthase enzyme. And dihydrofolate reductase enzyme is inhibited by which drug? It was inhibited by trimethoprim, important one. Okay, so please remember, it inhibits folic acid synthesis, and it is a bacteriostatic drug. Remember this, it just inhibits the growth of the bacteria, so it is a bacteriostatic drug. Important point. Okay, so now what you need to know, they have told you that the patient was on ulcerative colitis drug, that is sulfasalazine, and now he experiences some side effect of the drug, maybe that is generalized weakness, fatigue and pallor. Okay, and these are characteristic picture of anemia, and all the anemia types are given. So now you need to find out which is the characteristic anemia which is seen as a side effect of sulfonamide. So as we all know, the side effect of sulfonamide is aplastic anemia. So please remember, the important side effect of sulfonamide is aplastic anemia. So answer over here would be option A, aplastic anemia in this all lineages would be suppressed. Okay, so leukocytes भी कम होंगे, erythrocytes भी कम होंगे और platelets भी कम बनेंगे. Okay, so please remember aplastic anemia is the most characteristic side effect of sulfonamides which is seen. Okay, and this is the answer. The other important side effects that you need to know about sulfonamides, guys, apart from aplastic anemia, are your kernic teres. Okay, it causes bilirubin displacement. What happens is it causes accumulation or deposition of bilirubin in the basal ganglia. ठीक है, जब basal ganglia में bilirubin deposit होता है, it can lead to kernic teres. Okay, usually seen in neonates. Then it also causes renal failure. Therefore, it is contraindicated in cases of renal failure. This is also a nephrotoxic drug. Okay, so fat PSV में S was what? S was sulfonamides. So please remember, again, sulfonamides is also a nephrotoxic drug, contraindicated in cases of renal failure. And as sulfonamide, नाम से क्या पता चल रहा है? Sulfo means it contains what? It contains sulfur. And as we all know, sulfur जहाँ जहाँ allergy वहाँ वहाँ. Okay, ये याद रखना है. Punchline: sulfur जहाँ जहाँ allergy वहाँ वहाँ. So whichever drug contains sulfur, it can lead to one or the other type of allergy. And therefore, it also causes an allergy. It causes a rash on the body, a generalized rash on the body, which is seen. And this is Stevens-Johnson syndrome. This disease you might have studied in dermatology, guys. So please remember, sulfonamides can lead to a characteristic rash, that is Stevens-Johnson syndrome. Important one, Stevens-Johnson syndrome. याद रखना है. It is usually seen with sulfonamides. It is also seen with one more anti-epileptic drug. We'll also see it over there. Lamotrigine के साथ दिखता है. Okay, we'll see it in anti-epileptics. So please remember, Stevens-Johnson syndrome is seen. And as we know, sulfonamide is a part of which drugs? It is a part of SHIP drugs, okay? Sulfonamides. Therefore, it is metabolized by acetylation. And it causes a very characteristic side effect, that is SLE, systemic lupus erythematosus. Okay? We are done with this. Now, next one. A patient presented with enlarged lymph nodes, that is lymphadenopathy दिख रही है, and was diagnosed as a case of LGV. Diagnosed already, okay? I've told you LGV is what? It is a dermatologic disease which is a sexually transmitted infection. In this, usually there is a genital ulcer along with some lymphadenopathy, and this enlarged lymph nodes or lymphadenopathy are known as buboes in this disease. Okay, so LGV में enlarged lymph nodes को क्या बोला जाता है? We call it as buboes. Okay, याद रखना, ये डर्मा से बहुत important है. So genital ulcer and lymphadenopathy, diagnosed case of LGV. LGV is caused by which organism? It is caused by Chlamydia trachomatis. Which strain? L strain of Chlamydia trachomatis, which also causes trachoma. Okay, Chlamydia trachomatis. So which is the drug of choice in this condition? Any answers? Yes, very good. Blood-brain barrier is not well developed in cases of neonates. Therefore, pathological jaundice, which is usually seen in cases of neonates, that can predispose to causing kernic teres, and there can be some basal ganglia lesions. Okay, Parkinsonism like features दिख सकते तुम, right? Tremors वगैरह types या seizures दिख सकते usually. Answer to this question is very good, Nishan. The answer to this question is option A. Okay, the answer to this question is option A, tetracycline. We have already discussed the drug of choice for LGV is what? The drug of choice for LGV is tetracycline. Okay, clap. Okay, chancroid. C for chancroid. L for tetracycline. Sorry, L for legionella. Okay, A for atypical pneumonia. So please remember, tetracycline is the answer over here. Moving further, guys, to our next question now. Clindamycin is usually used in anaerobic infections. Apurva, please remember, clindamycin is usually used in cases of anaerobic infections. Tetracyclines are usually used in cases of LGV, lymphogranuloma inguinale, also known as donovanosis, all these conditions. Okay, so please remember, A is the answer, tetracycline. Okay, all these STIs, we usually use tetracycline except chancroid. Chancroid में क्या यूज़ कर रहे थे? मैक्रोलाइड्स यूज़ कर रहे थे. क्लैप वॉज निमोनिक. सॉरी, शायद मैंने मिक्सअप कर लिया था. सो प्लीज रिमेंबर, मैक्रोलाइड्स यूज़ कहाँ कर रहे थे? शैंक्रोइड्स में. क्लैप वॉज निमोनिक फॉर मैक्रोलाइड्स. मूविंग फर्दर टू आवर नेक्स्ट क्वेश्चन, गाइज, नाउ which states benzathine penicillin is the drug of choice for all the stages of syphilis except. So as we all know, benzathine penicillin is the drug of choice mostly for syphilis. So सिफिलिस के अलग अलग स्टेजेस क्या होते हैं वो पता होने चाहिए तुम्हें. सो सिफिलिस ईदर इज प्राइमरी सिफिलिस, सेकेंडरी सिफिलिस, देन latent syphilis. Latent syphilis can be divided as early latent syphilis and late latent syphilis, and lastly it is tertiary syphilis, which can disseminate into the CNS and cause neurosyphilis. So please remember guys, these are different stages of syphilis which are usually seen. Now, as we all know, primary, secondary and early latent syphilis, they are treated with single injection. Okay, they are treated with single injection of benzathine penicillin 2.4 million international units. ये पता है तुम्हें? Usually primary, secondary and early latent syphilis are treated with single injection of intramuscular benzathine penicillin 2.4 million units of injection. But whereas late latent syphilis and tertiary syphilis, they are treated with what? They are treated with sorry guys, they are treated with again the same injection, that is injection benzathine penicillin 2.4 million international units, but this time 3 injections. So please remember, 3 injections of benzathine penicillin are given. So सबके लिए drug of choice is benzathine penicillin. It just differs primary, secondary, early latent, single injection, late and tertiary, it is your 3 injections of benzathine penicillin. And yes, the answer over here is neurosyphilis mein, because in neurosyphilis, as we all know, benzathine penicillin, benzathine is added to penicillin G. Okay, and as benzathine is added, which cannot cross the blood-brain barrier, therefore in cases of neurosyphilis, benzathine penicillin is of no use. अगर वो CNS में जाएगा ही नहीं तो उसका मतलब क्या? Therefore the drug of choice in neurosyphilis would be plain penicillin G. Would be plain penicillin G. And why is benzathine usually added? So please remember, benzathine is usually added along with penicillin G to make it longer acting. And as we all know, the longest acting penicillin is your benzathine penicillin G. Okay, but as CNS penetration is not seen with benzathine penicillin, therefore penicillin G solely is given in cases of neurosyphilis. The answer over here is option D, neurosyphilis. I hope you know the lesions from dermatology for syphilis. I don't have time is not permitting me to take the lesions also, but yaad rakhna, primary chancre, secondary gamma, okay, all these are the lesions that you need to remember about syphilis from dermatology. Okay, now, and penicillin G, also remember, it is also the drug of choice for anthrax. Anthrax is an important infection, so I am telling you, it is also a drug of choice for anthrax. Now moving further to our next question guys, which is a patient presented to the derma OPD with complaints of itching in the groin. Okay, itching kahan hai? In the groin and in the interdigital cleft. What are interdigital cleft? These web spaces, okay, web spaces between the fingers are known as interdigital clefts. Okay, so यहाँ पे और groin में itching है. So which is the preferred topical drug? Preferred topical drug for the likely diagnosis. So they are usually asking about the drug of choice, but which can be applied topically. मतलब apply कर सकते हैं like a ointment or a cream. ठीक है. So let's come to a provisional diagnosis first. So what is a provisional diagnosis in this case? So provisional diagnosis, excessive itching which is seen usually on the penis in a young adult male, or on the groin, or in the characteristic most common site interdigital cleft web spaces mein. What is the diagnosis? It is your scabies. Okay, the provisional diagnosis we can make is scabies, which is also known as Jock's itch. Okay, Jock itch, which is due to Sarcoptes scabies, itch mite. Please remember, scabies is due to what? Itch mite, which is also known as Sarcoptes scabies. Okay, ascaris की वजह से होता है scabies. Okay, most common site of itching is your interdigital cleft. Nocturnal itching होती है. Most characteristic lesion are your burrows. Okay, I am just integrating all of the subjects over here guys to make it simpler for you to recall other subjects also. Okay, most characteristic lesion are burrows. So scabies is the diagnosis. So what is the drug of choice? Very good all of you. The drug of choice for scabies now is option B, 5% permethrin. Okay, and one more thing makes it important to be remembered, that I have asked about the topical drug. If I would have asked about the oral drug, then the answer would have been ivermectin. So please remember, oral drug used in cases of scabies is ivermectin, but the drug of choice or a topical drug used in cases of scabies is 5% permethrin. Okay, 5% permethrin. Isotretinoin is used in cases of acne rosacea वगैरह में पढ़ा होगा. Okay, so isotretinoin is used in cases of acne vulgaris वगैरह. Okay, so important one. Betamethasone is the steroid which is also applied topically in acne vagara, all other fungal infections also, right? So I hope now this is very much clear to you. Okay, now moving on to our next question guys. Okay, and steroids are also used in cases of scabies. Okay, which type of scabies? Norwegian scabies mein. So please remember, in cases of a severe scabies infection, that is Norwegian scabies is a very severe scabies with worst prognosis, in that we use generally steroids to suppress the immunity. We use scabies. Okay, moving further guys now talking about the last question of the evening, and that states a patient was started on some drug, okay, on some drug should be there, on some drug for malaria, and now experiences dimness in vision. Okay, sir, there is diminution of the vision. Which is the likely anti-malarial drug responsible for this side effect? Okay, we have studied about all the drugs. ACT is the drug of choice. Okay, northeastern states में artemether plus lumefantrine, other parts of the country में artesunate plus sulfadoxime pyrimethamine combination. Okay, all other drugs we have studied. For less than 6 weeks prophylaxis doxy, more than 6 weeks prophylaxis meflo. Okay, we have studied all of this. But we have not studied drug of choice for malaria and pregnancy. What is the drug of choice for malaria and pregnancy? Just tell me the answer. It is chloroquine. So please remember, the drug of choice for malaria and pregnancy is your chloroquine. Okay, so chloroquine is the drug of choice for malaria and pregnancy. One more drug which can be used safely in pregnancy is your quinine. Okay, so quinine and chloroquine can be safely used. Drug of choice remains chloroquine. Okay. And as we all know, a characteristic side effect which is usually seen with chloroquine is what? Ophtha से शायद पढ़ा हो तुमने, ophtha अगर होना बाकी है तो you read it. Okay, so please remember, a characteristic side effect of chloroquine which is seen, the most characteristic, is your bullseye maculopathy. Okay, so please remember what happens. There is bullseye maculopathy. The macula is affected. Okay, the central vision is gone. Scotoma दिखता है तुम्हें. Okay, so bullseye maculopathy is there. Okay, bullseye maculopathy which causes dimness of vision. Okay, it starts from dimness of vision and it progresses further to bullseye maculopathy. It progresses further to bullseye maculopathy. It is only on prolonged usage of chloroquine for almost 2 to 3 years. Bullseye maculopathy develops. Okay, याद रखना. Chloroquine is also a DMARD. What is a DMARD? DMARD is a disease-modifying anti-rheumatoid drug used in cases of rheumatoid arthritis. And one more important point, chloroquine or hydroxychloroquine is also used in cases of COVID-19. It was used prior in cases of COVID-19. India was the largest exporter, right? So please remember, COVID-19 में it was used as a prophylactic measure. It was not used for treatment. ये दिमाग से निकाल दो अगर है तो कि treatment के लिए नहीं use कर रहे थे हम. We were using it for prophylaxis of your COVID-19 for hydroxychloroquine and chloroquine. Okay, so please remember this is important. And quinine के साथ एक side effect याद रख लो, it can further progress to arrhythmia. It can cause arrhythmia. Okay, it can cause prolonged QT interval. So quinine can cause prolonged QT interval leading to arrhythmias. याद रख लेना ये important. So the answer here would be anti-malarial drug which can cause dimness of vision is your option C, chloroquine. Option C, chloroquine is the answer over here. Okay. So I hope guys everything has helped you. All this session has helped you throughout. But the important point is guys, I will always reiterate the fact that follow your faculty notes, follow your faculty classes, read it thoroughly and then come to all the revision classes. Then that it makes it easier to add up to your knowledge or to revise all these things properly. Okay, so this would definitely help you in revising things. Today I feel this was an awesome day because a news came from Japan that India won a gold medal in Olympics. Javelin thrower Neeraj Chopra won the gold medal for us. And why is the reason that I'm telling you? Yeah, definitely this is the thing that we should have pride in. But please remember, ऐसा लग रहा था एक पॉइंट पे that we could not win a single medal in Olympics, but he reignited the hope. Okay, Neeraj Chopra is a very good example to reignite the hope that anything is possible. Okay, if you just need to dream hard, dream big for it and work hard for it. Okay, so dream big and work hard continuously, persistently. Perseverance is the key. Okay, my quote is there. I'll tell you that in our next class. Passion, patience and perseverance makes you a physician. Okay, this is the quote I thoroughly and literally believe in, and I hope that would also help you in your preparations. We are there continuously to help you out in whatever endeavors you are taking. One of them is your December Fmg examination, and for that we are with you in the journey. So just consider me a part of your preparations, guys. Any issue, I am there, a call away. Just contact me on my telephone number that you already have. All the regular batch students of Afmg have these. Okay, we have been taking a lot of numerous initiatives in Afmg on this, so we'll be taking more of such initiatives, and I hope all of these would benefit you. So this is the Telegram group that I have written the name for, and AFMG India Global, the channel on which you are seeing this session, is the YouTube channel. Don't forget to subscribe it also and join the Telegram group for all the regular updates, for all the questions, and just give a feedback very rapidly in your chat box. How was the session for today? So I can wind up the session, and yeah, let's see you in the next session. Sir, some points about MRSA. So just remember Veer, MRSA के बारे में ज़्यादा कुछ याद नहीं रखना है. MRSA is methicillin resistant Staphylococcus aureus. Staphylococcus aureus is an intelligent bacteria जिसने क्या कर लिया, methicillin जो ट्रीट करने के लिए यूज़ करते थे उसके अगेंस्ट थोड़ा बहुत उसने इंटेलिजेंस से अपना स्ट्रक्चर जो है ऑल्टर कर लिया. व्हाट इट डिड, इट ऑल्टर्ड द पेनिसिलिन बाइंडिंग प्रोटीन. ओके, इट कॉज सम ऑल्टरेशन इन द पेनिसिलिन बाइंडिंग प्रोटीन, म्यूटेशन हुआ, एंड जिसकी वजह से क्या हुआ कि जो मेथिसिलिन था या पेनिसिलिन था, इट कुड नॉट बाइंड टू द स्टाफ ऑरियस नाउ. एंड अगर बाइंड ही नहीं करेगा तो एक्शन कहाँ से करेगा? सो प्लीज रिमेंबर दैट वाज द mechanism for methicillin resistant Staphylococcus aureus that it adapted. Okay, याद रखना. And for MRSA, therefore, the drug of choice used was vancomycin. Okay, and Staph aureus also develops a mechanism against vancomycin. Therefore, it was Versa. Versa के लिए drug of choice I told you, Dapto followed by Line. Side effects of quinine, just remember the important ones is arrhythmias, guys, and it leads to prolonged QT interval. Okay, it leads to prolonged QT intervals, which predisposes the patient to have arrhythmias. Okay, this is the common side effect which has been repeatedly asked about quinine. Okay, other side effects are also there, but these are the most important ones that you need to remember. Okay. Now I hope any feedback in the chat box. Thank you for today's session, guys. Just go through this code. Sometimes the questions are complicated and the answers are very simple, right? So as you have seen, sometimes you tend to think a lot, फालतू में दिमाग दौड़ाते रहते हो, but really answers बहुत easy होते हैं at times. So that was seen in today's session at some questions, right? सो प्लीज़ रिमेंबर, फालतू में किसी चीज़ के बारे में ज़्यादा नहीं सोचना है. जितना ज़रूरी है, जितना पढ़ना है उतना ही पढ़ना है. वॉट एवर इज़ इंपॉर्टेंट, ओनली दैट इज़ रिक्वायर्ड. तुम पूरा KDT तो पढ़ नहीं सकते, पूरा KDT याद तो नहीं रख सकते. सो दैट इज़ द रीज़न वाई यू आर कमिंग टू क्लासेस, वाई योर फैकल्टी इज़ नैरोइंग डाउन योर नोट्स, एंड द रीज़न वी आर हियर इज जस्ट टू मेक यू recall all those things while going through your notes, or making you just understand what are the most important points or the frequently asked questions that have been asked, or just make you practice some MCQs that you would not require. 25. Just a minute, I need to calculate. 30. So bedaquiline, capreomycin is a second line antitubercular agent, guys, that is not active against extensive or multi drug resistant TB. याद रखना मैंने क्या बोला था, extensive drug resistant TB में there is what, there is resistance to one of the injectables. अगर resistance है one of the injectables को, one of them is capreomycin. So the TB has already resistance to capreomycin. तो कैसे यूज कर सकते हो, right? So it cannot be the drug of choice because resistance is developed against it, right? So the answer over here are newer drugs. I hope this session was helpful for you guys, and thank you so much, Preeta. It means a lot. Everybody else also, please drop your comments in the chat box. How do you feel about the session, and any of the requirements that you need, that what kind of sessions you want in future. We'll be working on it. Okay, so we are very soon coming up with the integrated sessions also, so you will get benefited from that also.